We take one question per person, but that helps. The last one on the zoonotic source. WHO has been saying that knowing the source of the virus is very, very important. It's science, it's public health. We can fight the virus better when we know everything about the virus, including how it started. We will be sending a team to China to prepare for that, and we hope it will lead into understanding how the virus started and what we can do for the future to prepare. So we're planning to send a team next week. Thank you.
Okay. I think if we listen to interviews and others done by people who've led contact tracing in places like Singapore, in Japan, and in other countries, the primary success of contact tracing has come from a well-organized human workforce, able, number one, once a case is detected, once there's a positive sample in the lab, maybe it's from the emergency room, from the hospital, from the community, that there's an instant response where a case or their family can be interviewed, that contacts are identified quickly, and in that sense, the highest risk contacts. You can have a contact list that's 10,000 people, and you have to decide how far and how deep you go with listing potential contacts. They all have to be contacted and followed up. Of those who are followed up, you're asking, in most countries' situations, you're for those contacts to be self-isolated or quarantined at home. In some situations, people are asked to quarantine in a facility. So it's a very complex set of investigations, and then communication between different. One group has to hand off the process to one group, has to hand off the process to another group. So it's a complex interaction of public health activities. Now, obviously, when you're moving information around and you're trying to, the lab has to inform the contact tracers, and the contact tracers have to inform the people organising quarantine. All of those require a lot of transfer of information, and there are a number of digital tools that have really helped with that process. The system developed by WHO, Go Data, which has been implemented in a number of countries, and that allows public entities to integrate data from different sources within the system. There's no privacy issues there, because that's really about being more efficient with publicly held data. There are then other applications that have been developed which allow for mobility to find potentially other high-risk contacts, Bluetooth-enabled apps that allow that to happen. And some countries have implemented apps like that. And those apps can be useful in identifying contacts who may not have otherwise been listed, and in some ways also for looking at overall population risk for transmission. Some have worked, some have not. Well accepted at community level. Some have raised real issues regarding data protection and human rights and other issues. So it's important that we continue to innovate with these tools, but it's also important to recognise that that aspect of the digital revolution is innovating and providing potential solutions and tools. The core process is still a core human-driven process. It's about humans contacting humans and asking questions about potential exposures and following up with other human beings. This is not an automated process. It cannot be automated in that regard. And I think that's where most countries have struggled. It's an app. It's another thing to identify and train a human workforce that can go out and be disease detectives. And you'll see that in most countries who've been successful. What they've really managed to do is train community-based people who know their localities. They've trained them in how to do contact tracing. They've trained them how to follow up within their own communities, and that's much better accepted. And we found the same in Ebola Congo. If you bring contact tracers into small villages where people are outsiders, it's a potential flashpoint. So the more localized the response is, the better. And localization of public health intervention is a very important concept, and it's something that governments need to address. So I think that would be my advice. Localise contact tracing, bring it down to the lowest level, have it as much as possible based in and done by the community, and enhance the efficiency of that where you can with digital systems and applications. But they're not in themselves the answer. With regard to your second question regarding what have we learned, we're learning a lot, and interestingly, when we talk about contact tracing, we had a major meeting 2 weeks, experts from all over the world who've been implementing contact tracing. Today we have a meeting at Gorn, which is considering the outcomes of that meeting. I think tomorrow we begin a meeting on what we've learned in research over the last 6 months, in the next few days. And right now, 6-month period, we've been doing ourselves internally a number of internal retreats, looking at what we've learned over the last 6 months. Our program here is under the routine assessment of the Independent Oversight and Advisory Committee, which is a body that reports directly to the world. They did their first interim review of the response and the performance. That review was published at the time of the World Health Assembly, and in fact that committee has had a briefing today with the mission representatives of all the WHO member states. And that committee will continue with that review. There are currently reviews planned around the IHR Review Committee, and obviously the Director is pulling together a systematic independent evaluation based on the WHA resolution. But we're doing internal operational reviews. We continue to review all of our performance. We review all of the language, and I'll hand over to Maria because she may be able to also tell you how we're really learnt over the last 6 months.
Thanks, Mike. Yes, so we almost every time we've been up here that we are constantly learning and we are constantly evolving guidance to fit what is known about this virus that we didn't know about 6 months ago. I think the way that we do that is through our international networks, where we directly with frontline workers every day, whether these are clinicians and public health professionals, whether these are virologists, laboratorians who are working with cells, looking at sequences, whether we're looking at people who are working on infection prevention and control to prevent healthcare settings, looking at epidemiology and modeling under transmission is happening, how transmission is happening, and how that affects our guidance and our advice. We are constantly looking at how we adapt our information that we share with you, and with how we explain the situation about what we know, about what we don't know, and most importantly, how we're working with our partners to address those unknowns, because that is a constant evolution as a gen. I just want to mention one last thing is about what you can do yourself. The Director General mentioned this in his speech, but please feel empowered. Please know that you can do things yourself to prevent yourself from getting infected. And importantly, not only protecting yourself, but protecting your family and potentially somebody who is part of a vulnerable category, an underlying condition, or maybe of advanced age, who will go on to develop severe disease if they are infected. So knowing what you can do, if you're in a situation where there is increasing transmission or intense transmission, if you're asked to stay home, please stay home, because there are many people who can't. And those individuals who are working in healthcare facilities, who are caring for infected patients, who are in ICU, who are in hospital beds, they can't stay home. And if you can, please do. We know this is difficult, and we know that people want this to be over, and there are many things that we all want to do. But it's going to be difficult for some time before we get out of this. But we will. And so not only do governments very clear on what needs to be done, adapting that to the most localized level as possible, you also play a role. Men, women, children, all of you, all of us have a role to play.
Many thanks. We had a bit longer answers today, but it's because questions were good. We will take 2 more questions before concluding this press briefing. First, we will go to Chen from China Daily. Chen?
Hi. Dr. Tedros, you have repeatedly voiced concern over stigmatization and politicization of COVID-19. But U.S. President Donald Trump, just last week in speeches and rallies, continued to use words like Kung flu or China virus. Does WHO consider this as seriously undermining the global solidarity? And do WHO usually convey such concern to like US CDC? Thank you.
from WHO's perspective, we obviously want to have international discourse that's based on mutual respect. Encourage all people at all levels and in all countries to use language that is appropriate, respectful, and is not associated with any connotations that are negative. And in that regard, we put that message out globally. There are many people around the world have used unfortunate language in this response. We certainly haven't been immune to receiving a lot of it. But we try to focus on the way ahead. We try to focus on what we need to do. And we need everybody focused, as the DG said, as Maria has said. We need everyone focused. Everyone has a job. We can actually do better than we're doing right. We have a lot of vulnerable people to protect and shield. We have a lot of communities with poorer health systems and poorer living conditions that we need to help and support, and we need to focus on that. It is unfortunate if our global discourse is reduced to base language. That never helps. But we want to focus on moving forward. We want to focus on getting this job done.
Thank you, Dr. Ryan. And our last question will go to Jamil, our Geneva neighbor who is working for a number of Brazilian press. Jamil?
Yes, Tarek, thank you. Thank you for taking my question. My question is on Brazil. What is your current evaluation about Brazil, and whether this strategy that you just mentioned now for over an hour is actually being implemented? Thank you.
Certainly, because things, and I'll come to Brazil, but overall in the Americas, the situation is difficult. The Americas as a whole represent half the cases and almost half deaths in the whole world. If we look at if you look at Brazil itself, portion of all the cases in the Americas, 26%. That's 1 in 4 of all the cases and 1 in 4 of all the deaths in the continent. So there's no question that Brazil is still facing a big challenge. It continues to report over 30,000 cases a day from all 27 federal levels, or from all 8 levels. So Brazil is still facing a challenge. And yes, a comprehensive approach to the response is needed at all levels. It is tough. The force of infection is high. There are many challenging situations in Brazil. There are deeply congested and dense popular areas in the urban setting that have very poor services. There are people deep living in rural conditions as well, difficult to reach and difficult to serve. So it would be silly to underestimate the size and the complexity of a great country like Brazil. But equally, it would also be important to recognize that Brazil has a huge and proud history in the management of infectious diseases, and has many excellent scientific and other institutions, and has shown a tremendous capacity not only for combating infectious diseases, but developing vaccines that have stopped diseases like yellow fever in so many other countries. So encourage again once more that Brazil continues the fight against the disease, that Brazil links the efforts at level in a much more systematic way, that there is a focus on a comprehensive approach to controlling the disease and doing that in a sustained fashion. It is easy, obviously, to criticise any individual country, and no country, no organisation is without criticism or without fault or without difficulty in this response. Again, today's message is not about what happened last week, last month, or the last 3 months. And when the Director General talks about politicization as well, we all need to recognise that in many countries, the government is the government of the day, and we need to find a way for each government to find a way for each government to serve its people. And we need to encourage and support governments. We need to find all of government, all of society approaches, and when avoiding politicisation of the virus. That cuts both ways. And we may, in many situations, as individuals in society, have to provide encouragement and support for a government that may not be of our liking. And that is the difficulty and the challenge of national unity against a common enemy. When you choose national unity against a common enemy, you sometimes don't get to choose who leads you in that fight. And you have to find a way. You have to find a way to be able to take that forward. And that's the challenge for all countries now. And I would just say from my personal perspective that we cannot continue to allow the fight against this virus to become and be sustained as an ideologic fight. It cannot be. We cannot beat this virus with ideologies. We simply cannot. And I think everybody now needs to take a step back at 6 months. Everyone, every individual needs to look at, am I doing enough? And every politician needs to look in the mirror and say, am I doing enough? This virus. And I think we need to have a big conversation with ourselves. And now is the time, because we don't have time to waste.
If I just may briefly add, it has nothing to do with the policy, but it's about the science. And I would like to ask us to side on the side of science and to side on the side of public health and experience. We are learning from experience. We are learning about this virus. We know what works. We're not saying that it's easy. We're not saying that it will not time, and it will be difficult for individuals and families and communities and nations. But we are adapting our approach and tailoring our approach based on what we are learning. And we need people to be with science as we communicate this with you, as we adapt it within our guidance, as we modify these approaches going forward. We know what works in suppressing transmission, and we know what works for reducing mortality. Let's do that.
This will conclude press briefing. Still, we will have an audio file sent to you soon, and the transcript will be posted tomorrow. From my side, I wish you a very nice evening.
Thank you, Tariq, and thank you all for joining. And as I said earlier, we have a new timeline of the past six months, and would really appreciate it if you have a look and give us your feedback. And look forward to seeing you on Wednesday. Thank you.
The Senate Health Committee holds a hearing Tuesday to get an update on the coronavirus response and plans to reopen the U.S. economy. Witnesses include White House
every last benefit. And with all due respect to my colleagues on the other side who keep saying this bill has no chance in the Senate, who do you work for? Mitch McConnell or the American people? My constituents elected me to do my job, and that is to fight for their health care. And so I fully support the Patient Protection and Affordable Care Enhancement Act, because we need to do more to provide affordable health care and bring down the rising cost of prescription drug costs. This bill does that. I urge my colleagues to join us. Do your job today.
Purchase your tracks.
我哋係藍絲，我哋最叻係無知憂，我哋係藍絲，不如坐低話你知，我哋有幾白痴，你哋講咩我都唔知，我睇唔到，我聽唔到，我係藍絲，犯法就係犯法，一定要負責負責，交通燈同支燈柱仲有嗰塊玻璃，真係好鬼慘，我兩面都幫，總之我都一定要譴責，啱晒啲嘢就係犯法，只有一個中國，中國最厲害，沒有共產黨就沒有現在的中國，真的不是武漢的肺炎，不是也是從武漢市場傳出來的新冠肺炎。我哋係藍絲，我哋最叻係無知憂，我哋係藍絲，不如坐低話你知，我哋有幾白痴，你哋講咩我都唔知，我睇唔到，我聽唔到，我係藍絲。你哋係警察最勁抽槍濫殺，你哋冇偷水可以不問自取後數唔使怕，你哋冇 number 冇紀律冇 EQ 冇學歷，一齊去出個貓都可以 pass， 我哋支持 Madden， 我哋又支持 Ivan， 冇飲東文，唔好呼吸，唔好食飯，唔好住喺香港，唔好賴道理班曱甴仲唔走佬，勾結外國勢力收晒錢俾人洗腦，咁唔中意呢度又唔中意嗰度，唔好搞亂香港啲嘢爛晒，我會好心痛，示威還示威，唔好阻住我，最緊要有車返工，香港人真係好中意返工，我哋係藍絲，我哋最叻係無知憂，我哋係藍絲，不如坐低話你知，我哋有幾白痴，你哋講咩我都唔知，我睇唔到，我聽唔到，我係藍絲，我哋係藍絲，幾白痴有幾無知，我都係藍絲，喲我哋係藍絲，我哋係廢中廢老，喲我哋係藍絲，只係睇 TVB， 我哋係無知，我哋拎住 BNO， 我哋好愛國，我哋好愛中國，喲我哋係藍絲，我哋最叻係無知憂，我哋係藍絲，不如坐低話你知，我哋有幾白痴，你哋講咩我都唔知，我睇唔到，我聽唔到，我係藍絲。
Purchase your tracks. 即係咁。喺凌晨嘅時候，我見到首咁嘅歌，我冇理由唔起身唱㗎。我女神梁美芬喎，梁美芬喎，佢做咩啊？佢唱歌喎，佢咁完美，佢唱歌喎，佢處女下海喎，我唔 cover 下點得啊？係嘛？點解要攬炒？點解要破壞？香港已經爛晒，我哋乜都輸晒，係咪仲要攬炒？係咪仲要破壞？大家齊心一致，諗有冇辦法仲好啦？點解要攬炒？點解要破壞？香港已經爛晒，我哋乜都輸晒，係咪仲要攬炒？係咪仲賣？我哋齊心一致，搞好我哋嘅香港。為你分，究竟邊個氹你鑊金？其實你對音樂嘅心，我仲 respect 個對侵侵。我豎起對耳聽真，笑到着燈，嚇到我兩腳一伸。出歌同你點解要攬炒？點解要走去破壞？仲話香港已經爛晒，我哋乜都少叫晒。其實不如公道啲諗，究竟邊個逼成咁？用下個腦諗，做翻個正常嘅審審。政制混亂，冇做錯冇錯，制度咁壞點收貨？建制偽善，唔係話我告你仲得添喎。香港人加油！你哋真係唔好再出歌住啦！你哋啲歌實在太好聽啦，真係搞到我忍唔住呢要整個 death metal cover啦，嚟啦喂！好啊！真理冇法改變。信下嘢，唔使驚；信下嘢，唔使驚；信下嘢，唔使驚；信下嘢。明公園，搞到只有對與錯，面對挑戰，我哋真理不獲互對。你又唔聽，但你又唔病，咪你又唔做，做你又做你又唔認，認你又唔愛，愛你又唔幫，到你又唔講。其實冇相對，我用嘅解決，世公主秒解決。四個人站立你，四個人站立你，四個人站立你，四個人站立你，四個人站立你。
Thank you, Madam Speaker. I yield myself 3 minutes.
The gentleman's recognized.
Madam Speaker, I rise in support of the Patient Protection and Affordable Care Enhancement Act as we continue to confront the worst public health emergency in recent history. Our first priority must be to protect the health and safety of the American people. But during this pandemic, millions of people have lost their jobs, and regrettably in America, when you lose your job, you frequently lose your health insurance. Based on the job losses in March and April alone, experts estimate that over 26 million people across the country have lost their job-based health insurance. So with so many workers looking to turn to the Affordable Care Act basis for health care, we must be building on the progress we have made to expand access to affordable coverage. This is exactly what this bill does. For example, as my colleagues have noted, under the proposal, no person would pay more than 8.5% of income on benchmark silver plans through the marketplace. Moreover, we're fixing the so-called family glitch, a technical problem that prevents from getting affordable coverage, and we make that affordable coverage available for millions of working families. The legislation will also provide incentives to expand Medicaid so that low-income families across the country will have coverage regardless of where they live. It builds on existing patient protections by reversing the Trump administration's expansion of short-term so-called junk plans, which discriminate against patients with pre-existing conditions and are not required to cover essentials. These plans raise costs for everybody not in a plan and then abandon the patients when they get sick and actually need coverage. Finally, the Affordable Care Enhancement Act would save money for workers and employers by cutting the cost of prescriptive drugs and bringing them in line with the cost people in other countries pay. And when they talk about the loss in investments in research, listen very carefully. They're saying that reducing the cost of prescriptive drugs is a bad thing. And second, they're talking about a previous version of the bill. This version of the bill, we have an amendment in NIH so that those investments will continue to get made. In contrast, the Trump administration has continued to aggressively pursue the U.S. lawsuit. Just last week, the Department of Justice filed briefs urging that the Supreme Court overturn the Affordable Care Act. If that suit is successful, all of the benefits of the ACA will be lost. Millions of people will lose insurance. People with pre-existing conditions will lose their protections. Affordability credits will evaporate. Consumer protections will be lost. This will happen in the middle of a public health emergency. And for all on the other side that say that the Affordable Care Act has problems and they have a replacement, remember what the CBO said. Yield myself another minute. Remember what the CBO said about the bill that the Republicans, when they had the majority a few years ago. They said the costs would go up 20% the first year. 20-some million fewer people would have insurance. People with pre-existing conditions would lose their insurance, and the insurance you get is worse than what you got. We can't afford this major step backwards in our efforts to put quality insurance within the reach of all Americans, and this is why I urge all of my colleagues to support the Affordable Care Enhancement Act so that we can strengthen the ACA and ensure millions of Americans will have access to better health insurance than they have now, and certainly better than they would have if this lawsuit. So, Madam Speaker, I reserve the balance of my time.
The gentleman yields. The gentlelady from North Carolina is recognized.
Thank you, Madam Speaker, and I thank my colleague for yielding. I yield myself such time as I may consume. Madam Speaker, I rise today in opposition to H.R. 1425, the so-called Patient Protection and Affordable Care Enhancement Act, the latest in a series of attempts by House Democrats to score cheap political points at the expense of hardworking taxpayers. And scoring cheap political points, I think most of my colleagues and I are tired of having words put in our mouths that aren't there. We do not oppose reducing the cost of drugs. We want that. We don't believe it is a bad thing. At a time when Congress should be united in our continued fight against the novel coronavirus, ensuring the country can reopen safely, we are instead here today debating a bill that amounts to nothing more than political posturing. rather than solve any pressing health care problems, including the nation's response to the COVID-19 pandemic. This misguided legislation will limit health care options for patients, contribute to already skyrocketing health care costs, and double down on the many failures of the Affordable Care Act, or ACA. As the Republican leader of the Committee on Education and Labor, I'm committed to improving and enhancing employer-sponsored health care options for American workers and their families. Yet today we're debating legislation that would enlarge Obamacare even further by providing subsidies for some of the wealthiest Americans, providing a blank check bailout for insurance companies, strong-arming states into expanding and eliminating lower-cost health care options like short-term limited-duration insurance plans. Short-term insurance plans offer health care options for Americans who might find themselves between jobs or unable to afford rising premiums in the already expensive individual market. What's astonishing to me is that Democrats conveniently fail to mention that these short-term limited duration plans were illegal under the Obama administration and that states still have the authority to regulate these plans. As Republicans, we believe in federalism. If states choose to limit or prohibit the sale of these plans, they're free to do so. Instead of respecting the judgment of state lawmakers and local authorities to act in their states' and constituents' best interest, House Democrats are doubling down on a one-size-fits-all federal mandate. As we've seen over and over again, Washington knows best requirements simply do not work. Revised legislation before us today, federally dictated policies will only lead to fewer choices and premiums. Additionally, House Democrats have missed the mark with H.R. 1425 when it comes to COBRA notices for millions of workers. While there's room for improvement in this area, such as increasing transparency and allowing consumers to decide which plans work best for them, Democrats are instead blocking consumer access to information about other forms of valued coverage options outside of the ACA. Just when you thought it couldn't get worse, the blatantly political bill we're considering today incorporates Speaker Pelosi's socialist drug pricing scheme to cover up the hundreds of billions of dollars this government health care expansion would cost American taxpayers. The rising cost of prescription drugs is an issue that resonates with everyone in this chamber. 70% of Americans consider reducing the price of prescription top priority, and they're looking to us, their elected representatives, to get the job done, to get drug prices under control. That is why Congress started a collaborative effort and bipartisan process last year to tackle this issue. Unfortunately, this bipartisan collaboration was abruptly cut short by Speaker's introduction of H.R. 3, which was written in secret without member input or the regular committee process. Lowering drug costs should not be a partisan issue. Partisan socialist provisions included in the legislation before us today. Democrats are well aware that H.R. law. Senate Majority Leader Mitch McConnell has said it will go nowhere in the Senate, and President Trump has said he will veto the bill if it comes to his desk. Still, House Democrats continue to waste time during an unprecedented health and economic crisis on legislation that will die after House passage. Socialist drug pricing scheme is nothing more than a left-wing down payment on a government-run health care system that would eliminate private insurance and implement government-controlled rationing of prescription drugs. As I've said many times before, governments don't negotiate, they dictate. The Democrats' radical drug pricing scheme will eliminate choice and competition and jeopardize innovation, investment, and access to future cures. And we're considering this at a time when we are in the process of developing treatments and a vaccine for COVID-19. This type of unprecedented government interference in private markets and substantial increase in regulatory red tape proves one thing: the Democrat Party is being held hostage by their most radical left-wing members. The American people deserve better from Congress than the socialist drug pricing scheme in the bill before us today. They deserve a real solution that will lower the cost of prescription drugs without jeopardizing access to new treatments and cures. That is why House Republicans have introduced H.R. the Lower Cost, More Cures Act. This bill contains bipartisan, bicameral measures, and it can become law this year. Specifically, H.R. 19 will help lower out-of-pocket costs, protect access to new medicines and cures, strengthen transparency and accountability, and champion competition. Yet House Democrats are ignoring this bipartisan common sense legislation. Clearly, they prefer politics over progress. Madam Speaker, I'm deeply disappointed that we're here today debating yet another partisan ploy from my colleagues on the other side of the aisle. There are bipartisan solutions to many at our fingertips, including continuing to fight the COVID-19 pandemic. But Speaker Pelosi and her Democrat colleagues continue to turn their backs on bipartisan legislation to help the American people, and that is truly shameful. Serve the balance of my time.
The gentlelady reserves. The gentleman from Virginia is recognized.
Thank you. Madam Speaker, I yield 2 minutes to a distinguished member of the Committee on Education and Labor and the former Secretary of the United States Department of Health and Human Services, the gentlelady from Florida, Ms. Shalala.
The gentlelady from Florida is recognized.
Thank you, Madam Speaker. I rise today in support of H.R. 1425, the Patient Protection and Affordable Care Enhancement Act. Our country is facing multiple interwoven catastrophes, pandemic and economic crisis, and a reckoning over the denial of racial justice. Our job as Congresspeople is to help the American people through these trying times. This bill does just that, and the time to pass it is long overdue. Madam Speaker, my district has the highest enrollment in the Affordable Care Act's marketplaces, with more than 100,000 people getting their health insurance from the ACA. My constituents never had health insurance before the Affordable Care Act became law. Are at least another 120,000 people in Miami-Dade County who do not have access to health insurance because my state, the state of Florida, has refused to expand Medicaid. This bill will take critical steps to improve and expand the ACA and lower drug costs. It requires the Secretary of HHS to negotiate with drug manufacturers for affordable drugs for all Americans, a power I would have loved to have had when I was Secretary. It does exactly what the President asked for during his campaign. This provision alone will save Medicare $448 billion. Other critical provisions include expanding tax credits deeper into the middle class so that everyone can get affordable, comprehensive health coverage. My constituents are worried about their ones, their health care, and their country. Let's help them not worry about how for critical health care if they get sick. Thank you, and I yield my time.
The gentlelady yields. The gentlelady from North Carolina is recognized.
Thank you, Madam Speaker. I yield 3 minutes to the gentleman from Pennsylvania.
The gentleman from Pennsylvania is recognized.
Thank you, Madam Speaker, and thank you to the ranking member for yielding. I urge my colleagues to join me in opposing H.R. 1425. While we can all agree that Americans pay too much for health care and that the rising cost of prescriptions needs to be addressed, this bill is not the answer. The COVID-19 pandemic has affected each of our communities in different ways. We need to remain focused on helping our constituents reopen their businesses, get back to work, and remain protected from the virus. This bill does none of these things. Once again, we are wasting the American people's time debating something that will harm the healthcare system, move us towards socialized medicine, and provide fewer cures. This is especially troubling as it is at the odds with the Trump administration's steadfast goal of finding treatments and a vaccine for COVID-19, as well as protecting Americans from future pandemics. Just like H.R. 3, this bill irresponsibly coerces drug manufacturers into negotiating drug prices with the government, slapping a 65% tax on revenue if they don't come to terms, which increases to as much as 95%. In any negotiations that I've been part of, that's not how it works. In fact, according to the analysis done by the Congressional Research Service, letting the government set drug prices would violate both the Fifth Amendment's clause and the Eighth Amendment's excessive fines clause. Before the pandemic, I traveled across Pennsylvania's 12th Congressional District and met with patients and medical professionals who have told me that the best way to address rising prescription drug costs include patent reform to get generics to market quickly, price transparency so consumers know the actual cost of the medication they are purchasing, and incentivizing innovation to help find new cures. Rather than working toward fixing what has been brought about on the healthcare industry by Obamacare, this bill expands its flawed structure and attempts to force non-Medicaid expansion states into complying with the radical fantasy that resembles socialized medicine. There has been bipartisan work on healthcare reform like H.R. 19, which Republicans put forward last year. If the majority were more interested in finding real results, they might have engaged with us in real discussions to find common ground. We are interested in lower prices, more cures, and a healthier healthcare marketplace. Unfortunately, this legislation continues us down the wrong road. For these reasons, I oppose H.R. 1425 and urge all others to do so. I yield back.
The gentleman yields. The gentleman from Virginia is recognized.
Thank you, Madam Speaker. I yield 2 minutes to the chair of the Subcommittee on Higher Education and Workforce Investment, the gentlelady from California, Ms. Davis.
The gentleman is recognized.
Thank you, Madam Speaker, and thank you, Mr. Chairman. Usually, one's health insurance is not top of mind until it is. And this, Madam Speaker, is one of those times. We have to protect people's health care, men and women, whether it's battling the coronavirus, finding a cure for cancer, or even birth. Currently, Medicaid covers women for only 60 days postpartum, but life-threatening complications from pregnancy, as we all know, continue much longer. These illnesses don't follow a calendar. Regulations, of course, must align with reality. This needs to be changed. Unfortunately, this bill would extend Medicaid coverage to a year postpartum and provide women with critical coverage to help detect, diagnose, and treat potentially fatal complications. By better health awareness from the beginning, we can ensure that all babies are protected and cared for as they grow. When our nation is facing a health crisis, the logical reaction should be to strengthen health care, not to weaken it. We need to secure these smart policies to protect future Americans from the start. And I urge my colleagues to support the ACA Enhancement Act. And I yield back, Madam Speaker.
The gentlelady yields. The gentlelady from North Carolina is recognized.
Thank you, Madam Speaker. I now yield 2 minutes. From North Carolina, Dr. Murphy.
The gentleman from North Carolina is recognized.
Thank you, Madam Speaker. I rise today in opposition to House Resolution 1425. And to be honest, I'm a little bit baffled. We're in the midst of a global pandemic, the likes of which this world has not seen in over 100 years. But sadly enough, my Democratic colleague thinks it's a good idea to pass a law that would handcuff the availability of industry to create a vaccine and medicines to fight this disease. Are you kidding me? The price controls and regulations proposed in this bill completely incentive for these drug developers to spend money to invent new drugs. Imagine any company, pharmaceutical or not, being taxed at the rate of 65 to 95% of what they make. We need the next remdesivir or dexamethasone to save people's lives, and such policy would not allow this to happen. And so what has happened in the past because of overregulation? These companies have left the U.S. and gone where? Gone to China. And how has that worked out for us during this pandemic? China has thus had a stranglehold on this nation when it comes to the drugs that we need. In a time of national consensus, so we need to purchase fewer drugs from China. We want to ensure that more of them are developed there and that we have to respond to them. This is insanity. Madam Speaker, make no mistake, I absolutely do agree that the cost of drugs in this country are too high. I'm a physician. I still see patients when we're back in the district, and this is their #1 complaint. But there are bipartisan and common sense measures that we can implement to decrease the cost of drugs. Like I have said many times before, if we want to lower the cost of drugs, we need pharmacy benefit manager reform. We are the only country in the world that allows these middlemen to drive up costs. They nation over $800 million a year in drug costs. This is a bipartisan and common sense reform rather than this nonsense legislation that we can work on together to decrease the cost of drugs. Thank you, and I...
The gentleman yields. The gentleman from Virginia is recognized.
Thank you, Madam Speaker. Madam Speaker, I yield 2 minutes to a distinguished member of the Committee on Education and Labor, the gentleman from Connecticut, Mr. Courtney.
The gentleman from Connecticut is recognized.
Madam Speaker, today we vote on this bill, which improves the Affordable Care Act by cutting the cost of health care for families at an unprecedented American life. More than 2.5 million Americans have been diagnosed with COVID-19. In the insurance world, that means millions more with a pre-existing condition. Astonishingly, in the midst of this health, we should be protecting coverage. The Trump administration last week asked the Supreme Court to strike down ACA. If Mr. Trump has his wish, those 2.5 million Americans, along with 130 million others with pre-existing conditions, will lose the landmark pro-patient protection that has been on the books for the past 10 years, namely the right to health coverage even if you've been sick before, and the confidence and serenity to know that you won't be charged more because of an illness in your past. It's right there on the first page of the ACA, Section 2704, prohibition of pre-existing condition exclusions or other discrimination based on health status. Yet the administration, in its brief filed with the U.S. Supreme Court a few days ago, says the entire ACA must fall. That's a verbatim quote. Well, Mr. Speaker, if the ACA falls, pre-existing condition protections fall with it, along with age 26 coverage for dependent children and the elimination of lifetime limits on health coverage, which will devastate patients with chronic illness. Last night, the Wall Street Journal reported that the President once again admitted that neither he nor his Senate majority have the slightest clue what their plan is if their wrecking ball of the ACA succeeds. Madam Speaker, during the last 4 months' avalanche of layoffs, millions of Americans have desperately reached out to their state's ACA exchanges in search of health coverage after losing job-based insurance, 54,000 just in Connecticut alone. At this time of severe economic uncertainty ravaging communities, both rural and urban, we must do everything in our power to strengthen health insurance and make it more affordable, which this bill does. To shrink from this challenge and roll back the clock on 10 years of progress would be a complete dereliction of duty. Vote yes on this bill. I yield back.
The gentleman yields. The gentlelady from North Carolina is recognized.
Thank you, Madam Speaker. I yield 1 minute to the gentleman from North Carolina, Mr. Bishop.
The gentleman from North Carolina is recognized.
I thank the gentlelady for yielding. Democrats present a false choice. Either support the expansion of an already failed government-run health care scheme or let people go without health care. They want you to think that Republicans and the Trump administration have no ideas about how to expand coverage. Not the case. One of the first bills I introduced after joining last September was the Increasing Health Coverage Through HRAs Act. My legislation would codify the Trump administration's rule, allowing employers to fund health reimbursement arrangements for their employees. Thanks to President Trump, these HRAs can now be used to purchase individual market coverage.
For the White House press secretary when she steps up to the podium any minute now. Trump not briefed on something of this magnitude, and now that he does know, if true, what is he going to do about it, and will he hold Russian President Vladimir Putin responsible? Members of Congress, they also want answers, and they may get some during a briefing today. Republican Senator Lindsey Graham imperative Congress get to the bottom of recent media reports that Russian GRU units in Afghanistan have offered to pay the Taliban to kill American soldiers with the goal of pushing America out of the region. Now remember, this is all taking place at a time when the Trump administration is trying to negotiate a peace deal with the Taliban to end the war in Afghanistan, bring U.S. troops home. Multiple news organizations have now confirmed that in the New York Times, which said that Russia may have been trying to pay Taliban-linked militants to kill U.S. soldiers. And the Washington Post today really taking it a step further by saying that it is believed to have resulted, those Russian bounties are believed to have resulted in the deaths of several U.S. service members. So this is really a very serious issue with potentially huge geopolitical implications. communications, but President Trump maintains that he knew nothing about it. He tweeted last night that, quote, Intel just reported to me that they did not find this info credible and therefore did not report it to me or Vice President Mike Pence. Now, two other topics that are likely to come up in today's briefing: the president retweeting and then deleting over the weekend a video showing one of his supporters down in Florida yelling "white power," and then, of course, the other thing that's almost certain to come up is the surge in coronavirus cases in states like Texas, Florida, and Arizona as we head into this holiday weekend. Julie? Yeah, thanks, guys.
And I agree that I'm not in this for the things that judge me and the doctors say that the president is clear about, but it's important that that is this question of judges. And that he has said in interviews that put out a list like we should have. The question is whether it takes a thunder out of that to have to say, oh, this news briefing.
Hey Jason, it's John again, the Cubs position. Can you please put me back in the Thanks for all. Thank you.
But right now I have a large collection actually. So I have them.
Change what every time you change your puppet or something.
Turn it off, trace it down, change real fast.
Well, POTUS has.
I mean, I don't normally they don't change notes and stuff ever. I just have to make sure that stuff they want too far.
But like, you know, last night, like, it wasn't that incredible, so that's why you have to.
My only way of fixing it is just blowing it. So you can add more stuff into it.
Yeah, so
I almost never do that.
I was ready to go. I had
yeah.
And I noticed the ones that images on the spots. Yeah, it's water. Yeah, it's less
yeah, and honestly, I have that.
Yes. And it's like
even putting on the case and stuff though, it's just cool.
It was the position as a
my old standard size. Smart. But I don't know if that wasn't much out there. So they kind of RX full sense of body camera.
Yeah, that's great.
That's all I did.
Talk to good work.
Yeah.
Gotcha. That is
how much video?
None whatsoever. I'm shooting videos on my iPhone. That's enough for that.
It's horizontal.
Exactly.
Looks around 40 bucks. I don't care. I'll do it.
Well, your TV's still sideways.
You ever see that vertical video syndrome?
Yeah.
There's a cartoon.
Did you just have a birthday? Happy birthday. Happy birthday.
So you're allowed to drink legally now?
That's in another 2 years. Yeah. It says driving.
I'm Medicare in 6 months. So.
Parallel parking is a real tough one. Get it excellent.
Old man and a young man.
After the pandemic, they said like.
I just wonder if it's going to push back the other. We did forget the lunch.
Stuart salad? Stuart? Yeah, 2 o'clock? I don't know. What's this going to go with? Yeah, let's do 2. Yeah? 2 o'clock. To Bolton. 1:45? No, later. 2.
Is that term 2 o'clock?
Which is going? 2 o'clock.
What's 2 o'clock?
Yeah.
Tom's gone. Salad order, 2 o'clock.
It's not like I have
Salad pickup. Statement on the way.
Salad pickup is an ambassador, so he'll be in the driveway.
I want to pick up. Tom's picking up.
I was going to say, I was like, Tom, I might have to text you my order.
mail.
Great.
I can't drive over there. So
There's tips involved though, right?
Yes, I know.
I'm sorry?
I think there will be because we're going to have this briefing today.
it's a warm up.
Totally. Yes? Exactly. No, and I'm hoping that briefing. That's our hope. But no, come on. Yeah. Well, we're hoping. So hopefully she'll announce that. All right, cool.
You know how to get there, Bert?
That sounds great.
Bert, should we tell you a map?
Wonderful. Okay, good. It was fun to have you in this morning.
So it's on the wall up there.
Yeah. Yeah, it's great. Yeah, I know.
You can put it on your frequently.
Okay, cool. All right, I'll talk to you after the briefing. Okay.
You know, there's a new rule though, right?
Sorry?
You can't pick up for other people.
That's the winner's rule?
Yeah.
Oh, yeah, I can go right there. I haven't taken any. That's very long. Yeah, but they car I don't know. You should have just and he said, and the weird thing is, where that was, where another thing, motors, layered, wasn't like this. So, 2 bucks. 2 bucks. And you can see at the bottom it says contract. It's right next to adding a drink.
Okay.
Right here. Next to the sides.
Thank you.
Has James ever known? Did James ever know?
That's not volunteer. Who's talking? So I don't know. Of course not. Now what's going on here with these orders?
Rodney Batman's there.
Rodney's in the house.
Rodney's in the house.
Keep seats.
Hey.
All right.
Okay, 20 minutes. Come on.
2-minute warning before the briefing begins.
2-minute warning, anyone who cares, 2-minute warning. John is briefing.
Good work, John.
Great job.
Occasionally you give those warnings and no one cares. So, well, let's leave us alone.
That day when it was like my car, and I was like, because I was somewhere, probably 3 weeks ago, and it literally sounded insane. And I thought it was like my phone.
Yeah, that was the first part of the year.
It was crazy.
She stuck with it though. Didn't stop.
Yeah, she kept going. I mean, you can't really.
Yeah.
What do you do?
Understandably difficult.
Hello, everyone. Law and order are the building blocks to the American dream. But if anarchy prevails, this dream comes crumbling down. And streets is unacceptable, and anger is not enough. You have a president committed to action. The DOJ has arrested over 100 anarchists for rioting property. The DOJ has also charged 4 men in federal court for attempting to shoot of Andrew Jackson in Lafayette Square. The FBI has over 200 open domestic terrorism investigations ongoing. AG Barr has created a task force on violent anti-government extremists led by the U.S. Attorney's Office in New Jersey and the U.S. Attorney's Office in northern Texas. With 200 Trump-appointed judges confirmed, will be upheld. Democrats at all levels, federal, state, and local, have done nothing. Democrats blocked bipartisan police reform. Minnesota's Democrat governor failed to urgently deploy the National Guard. It took President Trump for that to eventually happen. His suggestion and the ultimate descendants into chaos there in Minneapolis. Democrat Minneapolis council members voted to abolish the police while they themselves were getting a private security detail. That's quite rich. Democrat mayor of Seattle called the CHOP zone, the autonomous zone, the summer of love. It is anything but that, with multiple shootings and desperate pleas for help unanswered by business owners. And 7 people were shot in 12 hours this weekend in the Democrat-run New York City, and 61 people were shot in Democrat-run Chicago, and 15 fatally killed. A Democrat state, a Democrat city. President Trump stands against defunding our brave police officers, caving to mob rule, and cancel our history. Let's be clear. The rampant destruction of statues is not a part of any ideology, but this anarchy is aided by failed Democrat leadership. And as President Trump, these statues, quote, are great works of art, but all represent our history and heritage, both the good and the bad. It is important for us to understand and remember, even in turbulent and difficult times, and to learn from them. So let's stand for law and order, for peace in our streets, and against anarchy. This is President Trump's vision for the future. Take questions.
Chris. Thank you, Kayleigh. I know you said that President Trump was never briefed on these reports about the Russian bounties and whatnot, but can you say...
Look, I'll say this, that the U.S. receives thousands of reports a day. They are subject to strict scrutiny. While the White House does not routinely comment on alleged deliberations, the CIA director, NSA, National Security Advisor, and neither the president nor the vice president were briefed on the alleged Russian bounty.
Has he been since briefed, since all of these reports came out?
So let me back up and say this, that there is no consensus within the intelligence community on these allegations, and in effect, there are dissenting opinions from some in the intelligence community with regards to the veracity of what's being reported, and the veracity of the underlying allegations continue to be evaluated.
And one more question, if I could. Is he upset that this intelligence was reportedly shared with the British government, but not him?
I have no further comment on that, other than to just point you back to the 2 assertions that I made previously.
Kristen.
Thank you, Kayleigh. How could the president not be briefed on the Russia bounty story? Was he out of the loop by his own intelligence community?
No, as I noted, there was not a consensus among the intelligence community, and in fact, there were dissenting opinions within the intelligence community, and it would not be elevated to the president until it was verified.
President Trump tweeted overnight, "Intel just spoke to me." What specifically does that mean? Spoke to him? Did that person, in fact, give the president a full briefing in that conversation?
Details on the president's private correspondence.
Tell us who's coming to the White House today and who's going to brief those lawmakers.
So what I can tell you about that is that last night, the Chief of Staff, Mark Meadows, called both Senator McConnell and Congressman Hoyer and said that he would be briefing 8 members from the committees of jurisdiction. So there was a by invitation extended, but no further details other than that.
Is that briefing going to happen today, Kayleigh?
Yes, it was ongoing at the time when I came out here, or at least it had started, I think, 30 minutes prior to me coming out here.
But they're going to come to the White House? I just want to be clear about what's happening. Remember, coming to the White House?
Yes. Caitlin.
Isn't it concerning that there was even a hint of credibility to this report that the Russians were offering to pay Taliban-linked American troops, and the president was not told about it? Has the National Security Advisor or anyone explained why they didn't think it rose to the level that the commander-in-chief should find out about it?
So intelligence is verified before it reaches the President of the United States, and in this case, it was not verified. I would note this, though. When the president, there's no stronger advocate for our servicemen and women than President Trump. He never hesitates to act when there is a threat to our servicemen and women. For example, in Syria in 2018, when dozens of Russian mercenaries were killed in retaliatory defensive U.S.-led strikes. Our adversaries have directly targeted U.S. or coalition partners. The president has not hesitated to act, but this was not briefed up to the president because it was not, in fact, verified.
So I understand it has to be verified, but not everything in his daily briefings or in the presidential daily brief that's the written document is airtight. They let the president know about what they are hearing. That's why it's intelligence. So why would that not have been something that rose to that level if, we're sharing?
The Security Council and the intelligence community constantly evaluate intelligence reports, and they brief the president as necessary.
So my other question is, if this does be borne out to where the president believes that it is true, what is he going to do to hold Russia accountable? Still going to invite Vladimir Putin to the G7, G8, whatever whatever you think in the fall.
I won't speculate on whether this intelligence is verified or not verified, and I won't get ahead of the president on further actions, but I would just point out that no one
are not disputing that this is not true.
There are dissenting opinions within the intelligence community, and I can confirm with you right now that there's no consensus within the intelligence community on these allegations. And further, I would just point out, I won't get ahead of the president on action. With regard to Russia, this president has been extremely strong on Russia, imposing sanctions on hundreds of Russian individuals, expelling dozens of diplomats, closing 2 Russian consulates, withdrawing from an INF treaty, and several other actions.
In the intelligence community.
I have no further notifications for you other than to tell you there's no consensus and there are dissenting opinions from some within the intelligence community.
You don't think this report is true?
I'm telling you this, that there's no consensus in the intelligence community. Dissenting opinions from some in the intelligence community exist. Darlene.
Thank you, Kelly. I wanted to go back to the tweet the president today and then removed. This morning you said that he didn't hear the phrase portion of the video, and that when it was signaled to him that that was there, he took the tweet down. So does the president retweet other people's tweets and videos without knowing the full contents of what he's retweeting?
No, he did not hear that particular phrase when he tweeted it.
And listen to the video before retweeting it?
He did, and he did not hear that particular phrase.
Also, given your opening, do you have any comment on Mississippi taking steps to remove the Confederate emblem from the state flag?
I would say that that's a decision for Mississippi to make. It's commendable that they took this action in a lawful manner and took the appropriate steps rather than trying to tear down statues and monuments.
Thanks, Kaylee. One follow-up on the Russia and then one on another issue. Does the president have a specific message for Moscow given these reports?
A specific message for Moscow? No, because he has not been briefed on the matter. As I noted, there's no consensus among the intelligence community, and there are, in fact, dissenting opinions.
All right. Separate issue, Jacksonville, Florida today apparently is issuing a mask order. That, of course, is where at least part of the RNC will be held later this summer. President's thinking about wearing a mask changed at all, given that order and given the increased cases in Texas, Florida, Arizona, and elsewhere?
So I talked to the president before coming out here. It's his choice to wear a mask. It's the personal choice of any individual as to whether to wear a mask or not. He encourages people to make whatever decision is best for their safety, but he did say to mask and to do whatever your local jurisdiction requests of you. Yes.
Thanks, Kaylee. There have been reports that some American service members actually were killed as a result of this Russian ban. What information do you have on that?
Look, again, I'm pointing you back to the fact that there's no consensus within the intelligence community. And I would also note that for those of you that are always taking the New York Times at their word, they erroneously reported that the president was briefed on this. He was not briefed on this, and neither was the vice president. So I'm buying into full-fledged a narrative from the New York Times that falsely stated something about the president, that you would wait for the facts to come out. And note, once again, no consensus in the intel community, and in fact, there are dissenting opinions from some within it.
But
you say that he wasn't briefed. Does that mean it wasn't in the PDB either?
He briefed on the matter. That is all I can share with you today, is that both the CIA director, the national security advisor, and the chief of staff can all confirm neither the president or the vice president was briefed.
Okay, I have a coronavirus question as well, please. Secretary Azar said that closing. This is cases are on the rise. This is a very serious time. Obviously, the vice president held a briefing on May. What is the president's message to the American people, and why aren't we seeing him publicly talk to the public, encourage them to do things to stay safe?
I would note that there was a whole coronavirus task force briefing on Friday where that the American public had were addressed. We're encouraged to see that fatalities are coming down, that this Sunday, I believe, we had our lowest fatality rate since, I believe it was March 22nd, so late March. What that signals to us is we're catching people in the communities. The people who are affected tend to be those, as Vice President Pence has noted, half of those testing positive are under the age of 35. This means we're catching touching people in their communities. We're aware that there are embers that need to be put out, but these signs of decreasing fatality, increased and enhanced therapeutics that we've identified 4 of them, dexamethasone, convalescent plasma, and remdesivir, and one other that they are working. Remdesivir in particular reduces hospital time by a third. So these things make us uniquely equipped to handle the increase in cases. Yes, Brian.
Haley, there's a national conversation going on right now about the proper place of symbols of the Confederacy, statues, memorials, names, and the president has repeatedly inserted himself into this debate. I think a lot of people are trying to understand what his view of memorializing the Confederacy is and the proper place of the Confederate flag. So a couple questions. One, does President Trump believe that it's a good thing that the South lost the Civil War? And then two, is he interested in following NASCAR's example and banning the Confederate flag at his own events?
Well, your first question is absolutely absurd. He's proud of the United States of America. Second, with regard to our statues, American statues, there's a Harvard-Harris poll released just last week that shows 60% of respondents said the statues should remain, and 71% said local governments should block groups from physically destroying the statues. So he stands on the side of preserving our history.
His rallies, is he interested in banning the Confederate flag at his rallies?
That would be a question for his campaign, but look, this president's focused on taking action, on fixing problems. It's why he had his executive order just a few weeks ago to keep our streets safe and secure. That's where his focus. I think that those who are tearing down statues, they do appear to have no ideology when they're tearing down statues and defacing statues of Matthias Baldwin, an abolitionist, Hans Christian Hegg, who died fighting for the Union Army during the Civil War. A memorial for African-American soldiers who fought in the Civil War was damaged in Boston, and a monument to fallen police officers was vandalized in Sacramento. This is unacceptable. It's why the president took strong action. It's why he has an executive order saying those tearing down statues will be punished to the fullest extent of the law. It's why 4 people will charge. He will not stand for. He stands with the 71% of Americans who say there is no place for tearing down these anarchists are doing across the nation.
Christian. It's okay to display the Confederate flag at his events?
Christian.
Yeah, thanks, Kaylee. I got a couple. First off, the president's been talking about this big infrastructure push. I'm curious if we're ever going to get a look at the proposal that DOT has been working on. And then secondly, info on how the Phase 4 negotiations are going. Do you get a sense that Congress is open to the back-to-work bonus that the president said he's in favor of?
I don't have any updates for you on Phase 4 or infrastructure, but the president has mentioned for the last 3 years he's very keen on Democrats coming to the table and working with us on infrastructure. He's keen on in a Phase 4 seeing a payroll tax holiday, which helps low-wage workers and those who need it most. These are real, effective measures that could help the American people, but the onus is to come to the negotiating table.
Well, is there any indication that this is going to be different than February? I mean, that was roundly denounced by all the Democrats.
Yeah, I won't get ahead of the negotiations. Stephen.
Thank you. I have 2 questions. First, about the statues. I covered pretty closely the Trump inauguration rioting trials, and those all ended in essentially jury nullification, and no one was convicted. And I was wondering if President Trump is concerned about the possibility that the same will happen with the people who were charged before for trying to topple the Jackson statue, particularly given his personal role helping apprehend suspects.
Look, that'll be a to make and for juries to make, but the president is very keen on seeing these actions brought to justice, because tearing down American monuments and defacing federal property and defacing the Lincoln Memorial are not things the American public want to see, as noted in a 1% poll.
Got it. And my second question is, over the weekend, President Trump retweeted a contrast of his presidency and President Obama's, and there was a chart of the different things that President Obama did and President Trump did, and one of the differences was President Obama approving the extrajudicial killings of Americans overseas. There was a little bit of confusion earlier in President Trump's presidency about his position on that. Are you able to clarify whether he opposes that?
Look, I would just say this. The president will always point to between his record and that of President Obama, which is what he was getting at with his tweet. You had on one hand in the Obama-Biden presidency the weakest economic recovery since World War II. With President Trump, we got to the hottest economy in modern history. with President Trump, you saw ISIS defeated with Vice President Biden and President. The so-called JV team of ISIS became the varsity team and overran two separate countries. So the president will always draw contrast with President Obama, and those are just two of the many, and he was drawing a contrast in that tweet.
Thanks, Kayla. I have two questions on COVID-19. First off, there we found out today the pricing of it going forward for roughly a 5-day trial. $2,300 for government-backed programs, $3,100 in the commercial marketplace. Does the White House approve of that price, considering there's been some criticism as to whether or not that's too high?
So, Blake, that's a really good, important and substantive question that I think deserves a good answer to. And first, the wholesale acquisition costs or the federal supply schedule is $100 for a course of remdesivir. But remdesivir is an inpatient drug done by infusion, and because it is an inpatient drug, the patient would be very unlikely to see the cost of the drug and to pay the cost of the drug, because the way that hospitals get reimbursed for inpatient drugs is that they are paid flat fees for admission. And as Secretary Azar, this means in layman terms that hospitals have to eat the cost of treatment used. But if they buy remdesivir for, let's say, $3,200, which is the wholesale acquisition cost, and that remdesivir drug saves that patient time in the hospital, they only spend a third of the time in the hospital as a patient without remdesivir, that would mean that the hospitals are actually profiting because they're getting the patient out early. So that's basically all saying that the patient will not see that cost.
With the price point.
Right.
And then secondly, just picking up what Jeff had asked about masks. You said the president had no problem with masks and that individuals should do whatever their local jurisdiction requests. However, the HHS Secretary Alex Azar said this week, quote, "We've got to practice social distancing. We've got to use face coverings when we can't practice social distancing." So if individuals are going into an area and social distancing cannot be practiced, should they listen to the local jurisdiction in which face masks might not necessarily be mandated, or should they listen to the HHS Secretary?
So the CDC guidelines are recommended but not required, and the president would encourage everyone to follow the orders of their local jurisdiction and CDC guidelines.
Thank you. So one question follow-up and then a separate issue. I just want to be clear, there are congressional leaders who are being briefed on the Russia situation. Not been briefed on the situation?
Look, this has been asked and answered. The president provided intelligence.
And how does he know, if he hasn't been briefed, how is he certain that Russia didn't put out these bounties?
The president is briefed on verified intelligence. And again, I would just point you back to the absolutely irresponsible decision of the New York Times to falsely report that he was briefed on something that he, in fact, was not briefed on. And I really think that it's time for the New York Times to step back and ask themselves why they've been wrong so often. The New York Times falsely claimed Paul Manafort asked for polling data to be passed along to Oleg Deripaska before having to issue a correction. In June of 2017, the New York Times falsely wrote all 17 intel agents had agreed on Russian interference before having to issue a correction that it was only 4 agencies. In 2017, February of that year, New York Times published a story claiming Trump campaign aides had repeated contacts with Russian intelligence, which even James Comey has said was almost entirely wrong, New York Times. New York Times published in March of 2019 by a former Times executive. The Trump campaign in Russia had an overarching deal that the quid of help in the campaign against Hillary for the quo of a new pro-Russian foreign policy. That's what we call the Russia hoax, which was investigated for 3 years with taxpayer dollars before ultimately getting an exoneration in the Mueller report. It is inexcusable, failed Russia reporting of the New York Times, and I think it's time that the New York Times and also the Washington Post hand back their Pulitzers.
Why hasn't the president condemned white power, Haley? Why hasn't he condemned that tweet?
Caitlin, you going live?
Yeah, I'm going to the lawn. We're going to our house.
Okay, thank you. Bye-bye.
Thanks,
Yeah.
I feel like you made some bold choices. Bold choices.
Thank you, Madam Speaker. Thank you, Mr. Chairman. Health care is a human right. The Affordable Care Act helped us live up to that value by giving over 20 million American people health care coverage, including millions with pre-existing conditions. But still, too many Americans don't have access to good, affordable health care, and drug prices are through the roof. One of those Americans is Suzette, in town, Maryland. Suzette told me that her insulin prices have skyrocketed over the last year, making it hard to offer a drug, afford a drug that she needs. As Elijah Cummings said, the Patient Protection and Affordable Care Enhancement Act will cut premiums in half, negotiations for drug prices, expand Medicaid, a lifeline for many who need support with mental health and addiction treatment service. During the global pandemic, we should be acting with compassion, most vulnerable in our country. This bill does just that. I urge a yes vote. I yield back.
The lady from North Carolina is recognized.
Thank you, Madam Speaker. I will reserve the balance of our time.
The gentlelady reserves. The gentleman from Virginia is recognized.
Thank you, Madam Speaker. Madam Speaker, I yield to English member of the Committee on Education and Labor, the gentlewoman from Nevada, Ms. Lee.
The gentlelady from Nevada is recognized.
Thank you, and thank you, Mr. Chair. I'm for the people of Nevada's 3rd District. I rise today to stand up for my constituents' access to health care and life-saving treatments and support the Affordable Care Enhancement Act. A constituent of mine, Mark, wrote to me recently. He's a retired and on Medicare, and he's also a diabetic who requires insulin to survive. He told me that the cost of his insulin is going up 400% with no warning or explanation. It is life or death for him because he needs the insulin but can't afford it. This moment should give us all pause. Millions are out of work, thousands are sick and dying from a global pandemic, yet life-saving medications are still out of reach for Americans who need them. And it's unbelievable that this administration continues its campaign to take away people's health care. Seniors like Mark deserve better, Nevadans deserve better, and Americans deserve better. Medication costs, rising premiums, and junk insurance plans are forcing people to choose between life-saving treatment and paying their bills. No one in this great country should have to make that choice. I urge my colleagues to vote for the Affordable Care Enhancement Act and give every American access to affordable health care. I yield.
The gentlelady yields. The gentlelady from North Carolina is recognized.
Thank you, Madam Speaker. I will continue to reserve.
The gentlelady reserves. The gentleman from Virginia is recognized.
Madam Speaker. Madam Speaker, I yield 2 minutes to the gentleman from Rhode Island, Salini.
The gentleman from Rhode Island is recognized.
Madam Speaker, I thank him for his extraordinary leadership. Thank you, Chairman Scott, Chairman Neal, and Chairman Pallone. 122,000 Americans have died from COVID-19. Nearly 2.6 million are infected. And in the midst of this deadly and historic global health pandemic, with infection rates continuing to rise all across our country, there has never been a worse time to try to rip away health care from the American people. But just last week, President Trump and my Republican colleagues filed in the Supreme Court to take away health care from 20 million Americans and to gut protections for 135 million Americans with pre-existing conditions. Now more than ever, Democrats are standing up to fight to protect access to quality, affordable health care. And the Patient Protection and Affordable Care Enhancement Act does just that. It lowers health care costs, it protects patients with conditions, it expands Medicaid, and it lowers the cost of prescription drugs. Our colleagues on the other side of the aisle have described these ideas as radical. Only in the Republican caucus is expanding health coverage and driving down costs and covering more people with pre-existing conditions radical. For the rest of the American people, it's a basic human right, quality, affordable health care. The Patient Protection Affordable Health Care Enhancement Act will do just that. My colleagues have been on a relentless campaign to repeal the Affordable Care Act in its entirety and promised they were going to repeal and replace. They've only tried to repeal. There's never been a replacement. And once again, we're stepping into the breach with building on the success of the Affordable Care Act in the midst of a global health pandemic to drive down health care costs, expand coverage, protect people with pre-existing conditions. I urge my colleagues to vote. Thank the gentleman for yielding.
The gentleman yields. The gentlelady from North Carolina is recognized.
Thank you, Madam Speaker. I'll conserve until the chair is ready to close.
The gentlelady reserves. The gentleman from Virginia is recognized.
Madam Speaker, I'm ready to close, and so I'll reserve.
The gentleman reserves. The gentlelady from North Carolina is recognized.
Thank you, Madam Speaker. Madam Speaker, propagandists have said that if one repeats a lie often enough, people will soon believe the lie and not the truth. Our colleagues are entitled to their own opinion, but not to their own facts or rewriting history. I want to repeat some comments from my Texas colleague, Ms. Brady, who spoke earlier in this debate. Republicans support children, seniors, and patients with pre-existing conditions. Republicans created the popular Children's Health Insurance Program that millions of families rely on today. Created the prescription drug program in Medicare to help seniors get the medicine they need. Republicans created the first law that established protection for patients with pre-existing conditions. That law, passed in 1996, is the Health Insurance and Portability Act of 1996. We want to have access to high-quality, affordable health care that fits their needs and make their own choices, not what Speaker Pelosi for them. Madam Speaker, the devastating effects of COVID-19 are still being felt across our nation. Yet today, Democrats are spending time pushing a deeply flawed partisan bill that is being used to score cheap political points instead of working on bipartisan solutions like lowering drug costs, ending surprise billing, and getting our economy back on its feet. We're left with H.R. 1425, a radical bill which will limit health care choice and double down on the failures of the Affordable Care Act. No investment or solutions, just more of the failed status quo from House Democrats, which will go nowhere after the vote today. Contrary to what Speaker Pelosi said, Democrats do not and cannot, in this bill, guarantee affordability of health care. What they do guarantee is government control with rationing, fewer cures, and less freedom for Americans. Republicans believe in just the opposite. Madam Speaker, I strongly urge a no vote on H.R. 1425, and I yield back my time.
The gentlelady yields. The gentleman from Virginia is recognized.
Thank you, Madam Speaker. I yield myself the balance of the time.
The gentleman is recognized.
Thank you. Madam Speaker, this bill will reduce the cost of prescriptive drugs. Americans pay twice as much, 3 times as much as 10 times more than those in other countries pay for the exact same drugs. This bill will allow the Department of Health and Human Services to try to negotiate better prices. Now, those on the other side have criticized reduced prices that potentially could reduce investments in research. But this bill offsets any such significant increases in investments in research at the National Institute of Health. This bill makes improvements to the Affordable Care Act by reducing premiums, expanding coverage to families, protecting those with pre-existing conditions, and reducing the number of uninsured. We've heard criticisms, but no description of a better alternative. We've heard about the 1996 law on pre-existing conditions, but that did nothing in the individual market, and that's what the Affordable Care Act protects. pre-existing conditions in the individual market. But look at what CBO said about the Republican bill when they had the authority and were able to pass the bill. They actually passed the bill that CBO said that it would increase cost 20% the first year, 20-some million fewer people would be insured, those with pre-existing conditions would lose some of their protections, and the insurance you get is worse than what you've got. We can do better than that by passing the Patient and Affordable Care Enhancement Act, and that's what we should do today by voting yes on legislation. I yield back the balance of my time.
The gentleman yields. All time for debate has expired. Pursuant to House Resolution 1017, the previous question is ordered on the bill as amended. The question is on engrossment and third reading of the bill. Those in favor say aye. Those opposed? The ayes have it. Third reading.
A bill to amend the Patient Protection and Affordable Care Act to provide improve health insurance affordability fund to provide for certain reinsurance payments to lower premiums in the individual health insurance market.
For what purpose does the gentleman from Oregon seek recognition?
Madam Speaker, I have a motion on the desk.
Is the gentleman opposed to the bill?
In its current form, I am.
The gentleman qualifies. The clerk will report the motion.
Mr. Walden of Oregon moves to recommit the bill, H.R. 1425, to the Committee on Energy and Commerce with instructions to report the same back to the House forthwith. After Section 2, insert the following. Section 3, effective date. This Act and the amendments made by this Act shall not take effect unless the Secretary in consultation with the Commissioner of Food and Drugs, the Director of the National Institutes of Health, and the Director of the National Institute of Allergy and Infectious Diseases certifies that no provision of this Act and the amendments made by this Act will adversely affect research on, development of, or approval of any drug, including any biological product, intended to treat or prevent infection with the virus that causes COVID-19.
Pursuant to the rule, the gentleman from Oregon is recognized for 5 in support of his motion.
Thank you very much, Madam Speaker. This motion should be adopted. It would prevent the bill from upending the very progress we're all counting on for our innovators to develop new vaccines to confront this killer coronavirus. You see, it simply states the legislation cannot take effect unless the Secretary of Health and Human Services certifies that no provision will adversely impact the research, the development, or the approval of any drug intended to treat or prevent COVID-19. Now, Democrats with a straight face have come to the floor today to move to do grave damage to medical innovation. The Congressional Budget Office has told us that on many occasions. Upwards of 30 to 100 drugs, depending upon the source, could never make it into the pipeline. Will that be a cure for COVID or a cure for ALS or a cure for cancer? We don't know, and neither the Democrats bringing it. But we do know the independent analyses show we will not see a lot of new medicine. Make sure one of those new medicines is not the cure to COVID or a treatment to save lives for people who are on ventilators. That's what our motion to recommit says is before you move forward with a known innovation killer, let's at least exclude treatments in COVID-19. Our communities are being ravaged. We all know these stories. We all share them with each other about done to lungs and organs and lives as a result of COVID-19. In the wake of this public health crisis, medical innovators have worked at an unprecedented speed to develop safe and effective products. We can safely begin to open our country back up and eventually return to normal lives. We've seen public-private partnerships to agree never seen before. Private companies are joining forces with competitors, government agencies, and nonprofits, and they've taken on substantial financial risk in order to bring safe and effective vaccines and treatments to patients as quickly as possible. But now this bill, we want to gut innovation in America. California Life Sciences tells us the provisions of this bill that were included in H.R. 3 could result in 88,000 innovation tech jobs, R&D jobs going away from America to somewhere else. That's the price of this bill. We know House Democrats oppose these dangerous price controls with passage of H.R. 3. We also know that one of the side benefits, shall we say, of adopting socialized medicine, access to new medicines when they do become available in as timely a manner as you do here. Compared to the U.S. and Australia, it takes an average of 19 months longer for medicines to become available to patients. Canada, it's up to 14 months longer. United Kingdom, 11 months longer. Those cures to cancer, those new medicines on the market, revolutionary sort of new innovations we all want. So all we're asking for here is before your bill becomes law, and by the way, the administration said they'll recommend a veto, before it moves through the path, let's at least make sure unintended but dangerous consequence of this bill does not take effect, and that is let's make sure that it will not inhibit research and innovation for a treatment or cure to COVID-19. That's what our motion asks for, and I urge a yes vote on the motion to recommit, and I yield back.
The gentleman yields back. For what purpose does the gentleman from New Jersey seek recognition?
In opposition to the motion to recommit, Madam Speaker.
The gentleman is recognized for 5 minutes.
Madam Speaker, I urge my colleagues to vote against the Republican motion. The motion to recommit is a distraction, and it provides cover to the pharmaceutical industry to continue to raise prices, just as we have seen them do on thousands of drugs this year alone. Moreover, my Republican colleagues would have you believe that it's the pharmaceutical industry alone that is responsible for innovation and for funding innovation in this country, which omits the critical role that the federal government has played and will continue to play in drug development and the discovery of novel therapies. Let me be clear, Madam Speaker. The investment in research for COVID-19 treatments and vaccines aren't being put on the backs of the pharmaceutical industry. It's Congress and the American taxpayer who made unprecedented investments as we race to find a cure for COVID-19. In response to COVID-19, Congress has invested over $8 billion for innovative biomedical research, development, and the purchase of new vaccines and therapeutics, including $4.4 billion in the CARES Act and $3.8 billion in the Appropriations Act in the last month or so. This Enhancement Act, combined with the HEROES Act, which the Senate has, would more than double this historic investment, bringing it to over $19 billion. And the managers to this bill adds another $2 billion. So based on the claims here today and this motion to recommit, my colleagues on the other side of the aisle would have you believe that we're forced to choose between two competing alternatives, either finding vaccines and treatments for diseases and viruses like COVID, or reducing drug prices that are gouging American families at the pharmacy counter every day. This is a false choice. From the Republican perspective, we have no choice but to allow the pharmaceutical continue to go unchecked and rake in record profits at the expense of those who need life-saving medicines. But it's fear-mongering at its worst, and it's blatantly untrue. This nation can and is doing both. There's more than enough spending in the system to reduce drug prices and ensure we do not impact research and development for treatments and cures, including a vaccine for COVID-19. We know that most big pharmaceutical companies spend more on marketing, sales, and overhead than research and development, and there's no reason why American families are forced to pay 3, 5, or 10 times more for the same treatments than countries. It's simply unfair. And that's why new polling has shown that 9 out of 10 Americans support direct negotiations by the federal government for the price of a treatment for COVID-19, and why people that they're going to be gouged for a coronavirus treatment when it's available, just like they've been so often gouged by other drugs that their families have needed to stay healthy. So, look, the bottom line, Madam Speaker, we can have innovation and lower costs, and that's what this underlying bill does. This establishes a fair price negotiating program that rewards true innovation by directing the Secretary to prioritize a drug's research and development spending, as well as the extent to which a drug represents a true therapeutic advance over existing drugs. I urge my colleagues to reject the motion to recommit. We know that in the last few months, drug prices have grown tremendously around the country, and drug prices increase a larger percent of your health care costs. People simply can't afford it. And that's why this bill does not believe the false choice of my Republican colleagues. And with that, I yield back and urge my colleagues to vote against the motion to recommit.
The gentleman yields. Without objection, the previous question is ordered on the motion to recommit. The question is on the motion. All those in favor say aye. Those opposed? The noes have it. The motion is not agreed
Madam Speaker, on that
the gentleman from Oregon.
I ask for the yeas and nays.
Pursuant to Section 3 of House Resolution 965, the yeas and nays are ordered. Pursuant to Clause 8 of Rule 20, proceedings on this question are postponed.
What purpose does the gentlewoman from California, Ms. Waters, seek recognition?
Pursuant to House Resolution 1017, I call up H.R. 7301, Emergency Housing Protections and Relief Act of 2020, and ask for its immediate consideration in the House.
The clerk will report the title of the bill.
H.R. 7301, a bill to prevent foreclosures and unsafe housing conditions resulting from the COVID-19 pandemic and for other purposes.
Pursuant to House Resolution 1017, the bill is considered read. The bill shall be debated for 1 hour, equally divided and controlled by the chair and the ranking of the Committee on Financial Services. The gentlewoman from California, Ms. Waters, and the gentleman from Michigan, Mr. Isenga, each will control 30 minutes. The chair now recognizes the gentlewoman, Ms. Waters.
Mr. Speaker, I ask unanimous consent that all members have 5 minutes within which to revise and extend their remarks on H.R. 7301 and to insert extraneous material thereon.
Without objection. Gentlewoman, Ms. Waters is recognized.
Mr. Speaker, I yield myself such time as I may consume.
Gentlewoman.
In strong support of H.R. 7301, the Emergency Housing Protections Act, Relief Act of 2020. This bill includes several provisions that were included in the HEROES Act and independently led by a number of members of the Financial Services Committee. So understand what we're attempting to do here today. As I said, this was a part of the HEROES Act that passed this House. But we've been waiting on the Senate to take up the HEROES Act. They're not taking it up. They don't seem to care. They don't seem to understand people out there who are going to be evicted. And so we have pulled it out of the HEROES Act, and we're taking it up independently so that we can send a message to the Senate that we want this measure heard. And so we have a number of members who have participated in putting this legislation together and who had independent bills to do so. That includes Representatives Lacey Clay, Denny Heck, David Scott, Chuy Garcia, Cindy Acne, Nydia Velasquez, Ayanna Presley, Katie Porter, and Al Green. Mr. Speaker, America was facing an affordable housing crisis before this pandemic hit. With so many families struggling as a result of, we're now on the precipice of an eviction and homeless crisis like we've never seen in our lifetimes. We can't wait any longer. Move. The CARES Act was an important step towards providing relief, but more help is needed. We knew, for example, that an eviction moratorium without the provision only delayed disastrous outcomes, as families would have to pay more than they could afford, a lump sum of 3 to 4 months of unpaid rent at the expiration of the moratorium. This House followed through on providing several additional and targeted housing solutions when it passed the HEROES Act. Unfortunately, in the 45 days since HEROES Act passed, there's been no action taken by either our Republican colleagues in the Senate or the Trump administration. This is simply unacceptable. As a matter of fact, someone said this morning, and I repeat, we have not heard one word, not one peep from this administration about rental assistance. We saw in the aftermath of the 2008 crisis what the consequences are when Congress acts too slowly. 10 million foreclosures, almost $17 trillion in household wealth loss, increases in rates of homelessness all across this country. And we saw how communities of color were disproportionately hit with foreclosures and a corresponding loss of wealth after they had been targeted with predatory mortgage products. Today, 5 million confirmed cases of COVID-19 in the United States, and over 125,000 Americans have died. The Centers for Disease Control reported that, as of the 20th, hospitalization
跟住咧就有嘉賓提問。今日 記得咧就喺2016年啦，立法會選舉喺港島區啦，6席裏邊咧有3個係建制派得到，3個咧就係民主派得到。而今年咧就有8隊嘅團隊咧參次民主派嘅初選嘅。今日咧8隊團隊都有代表喺度㗎啦。咁而大家見到啦，而家見到嘅座位同埋發言次序咧，都係我哋早前定㗎。好啦，今日嘅論壇咧，大概有幾個環節啦。一開始嘅時候咧，我哋會有一個自我介紹嘅時間，每人30秒，跟住會有特選片段同埋網民嘅提問，咁俾大家去搶答㗎。跟住咧就有嘉賓提問，今日嘅嘉賓咧就係袁彌明同埋立場新聞嘅代表林彥邦，而最後咧就有自由搏擊時間。咁每一隊嘅參選人咧係有3分鐘時間自由提問，選擇對手去。好啦，而家大概講完咧就係嗰個程序嘅問題啦。咁跟住咧，我哋就事不宜遲，就係先嚟咧就係大家介紹自己。咁我哋今日咧有8隊嘅參選人啦。咁咧就係梁晃維。梁晃維咧係中西區區議員，咁佢亦都係做過港大學生嘅外務秘書。
大家好，我係4年雨革失敗，令我反思香港未來抗6年新東補選，政壇3分天下。我見到本土派係香港嘅未來。之後嘅領袖係俾人被捕，甚至係出現大規模嘅 DQ 事件，但係令我哋陷入低潮都好，我從來都因為我相信以香港人為本位嘅政治理念，先係我哋香港未來嘅唯一出路。
好，唔該晒梁晃維。跟住係楊雪盈，楊雪盈係獨立民主灣仔區議會主席。
大家好，我係楊雪盈，灣仔區議會主席，亦都係獨立嘅民主派。喺5年前，我隻身走入區議會，以1比12嘅姿態抵抗。喺舊年，我有幸同一班同路人一齊將區議會主導翻嚟。我希望用2次勝選區議會嘅經驗，同大家一齊將香港人嘅光連結，讓我哋和而不同，讓我哋團結一致。請支持我，楊雪盈。
好，唔該晒楊雪盈。跟住咧係徐子健，徐子健係東區區議員，政治聯繫柴灣起動。
Hello， 大家好，我係徐子健，係一位東區區議員。我由14年雨傘運動之後到經歷到今日，我經歷過3次嘅奇蹟。一次係我打贏咗鍾樹根，一個素人贏到鍾樹根。第二就係呢個嘅逃犯引渡條例，當大家以為我哋冇辦法拉到嘅時候，有好多人走咗出嚟幫我哋拉到咗。第3次就係柴灣12個區由紅區變成呢個全黃嘅地區，所以希望大家嚟緊可以支持我徐子健，多謝晒。
好，跟住係羅冠聰。羅冠聰嘅政治聯繫係香港眾志。羅冠聰4年前喺港島區參選，當時係第2高票數係當選嘅，但係就被 DQ。
大家好，我係香港眾志羅冠聰。4年之前呢，有超過5萬名港島選民將我送入立法會，但呢4年間，我經歷因為人大釋法而被取消，去耶魯大學進修，再去到國際連結做為香港人發聲嘅工作。時至今日，我以一個更加有歷練嘅姿態重新投入選舉。喺呢4年，我都知道政府對我嘅打壓係永遠唔會止息，即使佢一路都係想我冇辦法進入立法會，但我依然會與民同行，繼續抗爭。
好，唔該晒。跟住咧就係鄭達鴻，鄭達鴻係東區區議員，政治聯繫係公民黨。咁鄭達鴻咧4年前亦都係參選隊嘅。請鄭達鴻。
大家好，我係公民黨鄭達鴻。有時候你幾好嘛，變成平安就好。香港人，我哋甘心認命嘛。7年前落到全港最紅嘅北角區，成為唯一一位民主派區議員。我哋唔認因為佔中案判刑未能夠繼續參選，但係最緊要嘅係香港人，我哋無愧於心。希望大家支持我入到議會接替佢嘅工作，5大訴求缺一不可。
好，唔該晒鄭達鴻。跟住咧係彭卓棋團隊，彭卓棋咧係南區區議員，而佢嘅拍檔張嘉莉今日都喺度嘅。彭卓棋。
大家好，我係港島區彭卓棋團隊，昂首拒默沉，吶喊聲響透，盼自由歸於這裏。我哋面臨國安法眼境，我哋抗拒默沉；面對極權嘅奴隸，我哋吶喊高呼，聲討賣港派、港共派、中間派，再懸離槍。我哋嘅敵人就係共產黨。我哋入到議會，不惜以肢體抗爭，癱瘓政府，否決財政預算案，用議員身位支援街頭抗爭。請投我哋。
好，時間到啦。好啦，時間到啦。跟住咧請許智峰，許智峰係民主黨立法會議員，4年前咧喺港島區嘅選區裏邊當選嘅。
好，大家好，我係民主黨許智峰。香港跌咗一步嘅管治，我哋香港人所珍惜嘅價值同由咧，正在慢慢失去。 但我哋香港人絕對唔可以習慣暴政對我哋嘅壓迫嘅，我哋要反抗。咁所以無論係議會嘅抗爭，我哋要做到盡；無論係私人檢控，我哋做到盡。喺街頭更加唔可以少得我哋嘅蹤影。議會內外寸土必爭，我請大家支持我。我係民主黨許智峰，多謝大家。
跟住係袁嘉蔚，袁嘉蔚係南區區議員。
大家好，我係南區區議員袁嘉蔚。與弱勢同行，向極權抗爭，係我2013年走進社會運動至今一直堅守嘅信念。議會抗爭唔係單單靠投反對票，係需要一班用盡所有方法抗爭嘅民主派。裡面有家庭破碎、手足被捕，甚至流亡海外。佢哋就係我哋嘅理由，長夜守望，昂首對抗。請支持我袁嘉蔚。
好啦，夠鐘，唔該晒。好啦，呢個自我介紹嘅環節就到呢度啦。8位嘅候選人啦，同埋參選團隊啦，都發表過佢哋嘅30秒嘅自我介紹。跟住呢，就係我哋嘅特選片段同埋網民題，大部分嘅問題呢都係搶答題嚟㗎。嗱，首先呢，請大家睇下台面掣呢，大家試下撳一撳先，試一試掣先，係啦，大家撳一撳先 ，OK。嗱，咁呢個係一個大部分咧都係一啲搶答題嚟㗎。咁首先咧，喺特選片段嘅環節咧，我哋係會分2次啦，每次有一條嘅短片。咁短片咧，第一條短片附有問題嘅。咁完咗之後咧，就請大家撳掣搶答啦。咁提多一次大家啦，就係咧，請聽完我講，即係準備3、2、1之後咧，先至好撳。否則咧，你早咗撳，即係偷步咧，係會即刻被 DQ 就冇得答㗎啦。好啦，嗱，首先咧，我哋就播第一條片段先。
我係一個手足。首先，我想問下本土派，見到而家本土派同埋泛民主派就住今次立法會選舉上邊出現咗好大嘅分歧。例如參加初選嘅，咁假設選出嚟嘅本土派同埋泛民主派勢均力敵，你哋互相之間作出呢個協調。然後我想問下泛民主派，你哋喺街頭運動方面一直都處於一個比較保守嘅狀態，例如喺7·1立法會嘅一日，有議員喺大門外阻撓示威者攻入立法會。咁有機會，我想問下，你哋嘅定位會係點樣呢？
好啦，咁呢條問題咧，無論你係本土派抑或泛民主派都可以答嘅。呢個喺台灣流亡手足嘅問題就請大家搶答啦。3、2、1，係徐子健搶到㗎，徐子健。
係唔該，要同頭先嗰位手足講翻，對於你唔好意思嘅。至於你話點樣將本土派同埋泛民主派結合，其實大家只要退一步，然後大家齊上齊落嘅心態，我相信係可以做到。尤其是今次面對不公義嘅政權。至於你話民主派、泛民主派比較保守，我都相信喺未面對而家國安法壓落嚟嘅情況之下，大家係冇得退。只有不斷向前嘅啫。
好啦，時間夠啦，跟住咧，我哋睇第2條片。
大家知道，其實我哋香港人真係冇得再輸㗎啦！我哋香港人真係唔可以再輸。當係10年，你諗住10年，我哋公民社會就會一沉百沉。
好啦，大家都好對呢條片好有印象啦，就係梁繼平咧喺舊年7·1嘅時候喺一旦香港人輸，未來10年公民社會就會被一沉百踩啦。咁啦。而家1年後嘅今日，大家點樣睇佢呢個講法呢？請各位搶答。3、2、1。請梁訪。
梁繼平嘅講法係提醒緊我哋香港人，任何時候都要有一個當家作主嘅決心。因為我哋知道香港人若果我哋一直咧係跟從嘅政權嘅制度去玩嘅話，我哋好有可能咧係根本唔能夠突破現時抗爭嘅框架。喺1年之後，我哋更加清楚政權對我哋打壓係從來唔會停止。香港人係唯有用盡自己嘅勇氣，團結一致，走出制度以外，我哋先至能夠咧係奪回屬於我哋嘅香港。
好，我哋嘅時間差唔多啦，咁跟住落嚟咧就係網民提問嘅時間。我哋早前咧就收集咗網民對於大家嘅一啲提問啦。嗱，首先咧就有2條問題咧就指定人去答嘅，咁大家可以搶答。我首先問咗一啲指定問題先啦。嗱，問題咧就係指定問鄭達鴻㗎。咁問題嘅係 Amy Pang， 咁佢話要光復法治，法治爛成咁。憑佢光復法治呢？請鄭達鴻具體説明點樣光復法治？係唔係你唔敢講光復香港， 所以就講光復法治，就唔驚被 DQ 呢？請鄭達鴻。
首先，我絕對夠膽講光復香港。光復法治係一個法律從業員都應該係要做嘅畢生嘅責任。我哋面對一啲手足俾人拉咗被捕嘅時候，我哋要做盡法律支援，用我哋嘅層面去救佢，亦都係上庭用任何嘅方法去為佢揾一啲案例，係令到佢可以出到嚟。呢個就係光復法治嘅重要性。而且今次攞到35+，我哋就可以由制度根本改革，呢個先係光復法治嘅最好嘅方法。咁所以希望大家支持我哋35+入到議會。
好，時間夠，跟住有條問題咧就指定問楊雪盈㗎，咁係 hold 問嘅，咁話想問楊雪盈，你連區議會主席都未做得好嘅，解要參選立法會？
區議會主席係一個非常之唔容易嘅工作。我喺我嘅任期裏邊，其實亦都已經係同大家一齊係反對國安法，亦都就住我哋好多嘅政治嘅事件，我哋唔怕民政處嘅打壓。所以我相信，無論我喺邊一個崗位，最緊要嘅就係要幫到香港人，要幫到呢一場運動。我相信我哋只要將我哋唔同嘅就住唔同嘅人嘅崗位連結埋一齊，我哋一定可以發光，一定要照亮更加多嘅地方。
好啦，嗱，跟住有5條問題啦，我逐一問啦。咁呢5條問題咧，大家都可以答㗎。咁都係記住啦，講多次就係我講咗3、2、1之後先至好撳掣。好啦，呢條問題咧係阿 Don 問嘅，咁佢就話：各位民主派朋友，將來嘅路上可能要面對必須冒生命危險嘅情況，咁可唔可以透露下，萬一面對嗰個情況，你哋會點樣應付？3、2、1。係啊，徐子健。
係，唔該。要回覆翻啦。其實好早前係D100嘅訪問啦，我都有講過，而家做議員的話係要預咗俾人拉，預咗俾人打，預咗俾人虐待。咁呢啲心理準備，我講得出嚟嘅時候，我亦都相信在座呢度各位朋友都會有呢啲咁嘅心理準備。唔該。
好啦，跟住梁和問嘅，咁佢問咧就係當選咗之後，會唔會俾30%人工俾在囚義士咧？3、2、1。
我相信呢個問題咧，其實係非常之簡單，因為我哋見到喺過去1年入面有咁多義士因為參與抗爭運動而入獄，甚至係流亡。我哋一班立法會議員能夠進入議會，係因為佢哋嘅付出，而唔係我哋自己個人嘅努力。所以呢30%人工，我哋係絕對願意，或者亦都應該有個道義去幫助一切嘅在囚義士，同埋去支援呢一場嘅抗爭運動。多謝。
好啦，問題答完啦，我哋跟住再有另外嘅網民嘅問題啊，咁呢個就係 Man Yuen 問嘅問題，佢就問啦，就係點解或者點睇民主派議員近喺任命終審法院首席法官嘅時候投支持或者棄權票啦？1，梁晃維撳掣咁快嘅你？
我覺得民主派議員咧，佢好多時候都同我哋講話，佢哋需要光復法治，或者係守住香港司法系統。但係今日面對一個咧帶頭 DQ 咗梁頌恆、游蕙禎嘅一個張舉能，佢哋連投一個反對票嘅勇氣都冇。話俾佢哋聽就係今時今日民主派依然係希望香港人係相信而家嘅制度，相信香港嘅法治有險可守。但係街頭抗爭者已經用佢嘅行動去話俾民主派要嘅並唔係呢一啲嘢。多謝。
好啦，跟住仲有最後2條問題嘅，呢個問題咧就係 Chan Ming 所問㗎，咁佢就問啦：如果同以往一樣舉下牌，乖乖收3次警告，俾人抬離場嘅，麻煩你唔好選就好過選。你哋入到去會用乜嘢方式做議會？3、2、1。今次係鄭達鴻。
好，頭先有人話淨係光復法治唔夠咁，其實喺呢個議會抗爭咧，其實有唔同嘅手段，包括郭榮鏗係喺內務委員，咁包括郭家麒亦都喺8月26號有單案件啦，係因為喺立法會上庭，呢啲就係民主派一如既往嘅即係越嚟越進步嘅一個抗爭。咁所以希望咁多位市民啦係可以睇翻議會抗爭唔淨止係一種手段，係一種策略。
好，最後一條網民嘅問題係 Miss 虛，咁 Miss 虛就問：唔好成日講35+，你有冇諗過35減嘅議會抗爭係點呢？3、2、1。今次又係梁晃維喎，你準唔準備？
係，
都係問啦。
我其實好清楚知道咧，其實35+係今日我哋希望一定會用盡所有手段 DQ 我哋嘅候選人、當選人，甚至係拘捕我立法會議員，令到35+係變成35減。 喺35減嘅議會入面，我會用盡一切可行嘅手段，包括肢體抗爭嘅方式，去為香港人爭取更加多嘅時間，令到我哋喺街頭、喺國際電視上面係能夠引起更大迴響，令到香港人即使喺35減情況之下，仍然力抵抗一切惡法。
好啦，網民提問嘅環節到呢度啦，跟住落嚟咧就係嘉賓提問。出席今次港島區初選論壇嘅8位參選人啦，咁就會逐一咧接受我哋嘅嘉賓嘅提問㗎。咁而次序咧就係我會喺呢個箱度抽籤去決定次序。而今日嘉賓提問嘅環節裏邊，2位嘉賓分別就係袁黎明同埋代表立場新聞嘅林彥邦。2位好啊！2位嘉賓咧就準備咗一啲度身訂造嘅問題咧，各位參選人㗎啦。咁佢哋咧亦都會自己控制節奏啦。咁冇乜事咧，我就唔出聲，我負責抽籤嘅啫。好啦，首先咧就係羅冠聰。
好。
羅冠聰，我想問你，其實頭先你自己喺開場白嘅時候，你都講得好清楚咧。其實你覺得政府係即係千方百計要令你入唔到立法會，即係話其實你預咗自己會俾人 DQ 係咪
？Hello， 阿邦同埋 Erica。咁頭先我喺個開場亦都講得好清楚啦。政府呢4年對我嘅打壓真係層出不窮，包括係取消我議員資格啦，令我入獄啦。咁去到今日咧，其實我都覺得 DQ 依然都係一個十分之不公義嘅事情嚟㗎。由16年梁天琦、陳浩天為咗佢嘅政治理念而被 DQ， 去到今日我哋見到個紅線越嚟越闊。我喺度最重要嘅一個唔可以對呢啲政權嘅打壓變得慣咗，從而唔敢反抗。所以我參選就一個 statement， 就係一個我嘅政治信念。
你冇答到我嘅問題，我嗰個係好簡單嘅 yes or no， 係咪你預咗自己會俾人 DQ？ 係。咁點解你仍然要出嚟選呢？投票俾你嘅人，投呢一張票俾你嘅初選入邊，係預咗你俾人 DQ 嘅話，咁佢投嚟做乜嘢咧
？DQ 其實就係一個最大嘅政治打壓，而我初選其實唔係正係為咗去揀一啲參選嘅人，其實當中都有一個對路線、對政治嘅一個堅持喺度。咁會 DQ 當然係我喺而家紅線拉得咁緊之下嘅立場啦。咁但係對我嚟講，我嘅政治信念都係唔會變。大家支持我就係支持我嘅一個政治信念。喺初選投票俾我就係投票俾我代表嘅一種路線。
你哋嘅路線係乜嘢呢？因為其實眾志就改咗你哋個章程，即係你個章程其實會變的話，到底而家佢哋揀緊嗰條路線係乜嘢？
而家路線眾志好簡單，其實就從1年前嘅反送中運動開始，大家都講議會喺呢3方面眾志過去1年咧都係做好多唔同嘅工作，尤其是國際線啦，我哋會有好多唔同嘅國際倡議，同埋去唔同嘅國際同埋説話，所以呢一方面咧，我哋未來一定係會繼續堅持去做。
其實好難啊！以我哋群眾啦，或者立法會啦，係去同呢個共產黨鬥爭。咁你都講到國際戰線係咁緊要啦。咁你點解會選擇再留喺香港係做立法會？你唔覺得國際你唔應該係365日都係應該喺國際游說工作咩？
第一就係我覺得立法會議員當然有佢嘅民意授權去到做國際游說工作，或者去有佢嘅優勢啦。第二就係其實國際連結一定係要同本土運動咧係會做一個扣連嘅。我哋見到其實如果唔係有反送中運動咧，我哋過去由16年開始提倡嘅香港人權及民主法案咧，到而家都係唔會被通過嘅，因為國際係冇辦法見到香港勇氣同埋佢哋付出感動。咁所以咧，本地嘅運動同埋國際連結缺一不可。參與立法會選舉就係要將呢一個理念喺香港嘅政治當中帶出嚟，並且同大家講，即使我係會面對，我係會預期到政府咁無理嘅政治打壓，但係我依然會為咗我嘅政治信念付出。
但其實你頭先講嘅入邊有一個矛盾，個矛盾就係喺你哋之前做嘅國際連結工作期間，你哋係冇一個立法會議席，但係依然做到。咁而你而家參選，你又預咗會俾人純粹係攞一個命的。你睇下有咁多人支持我，然之後你繼續去做國際游說，其實同個立法會選舉好似冇關係。
其實嗰種預咗俾人 DQ 嘅感覺，就係想凸顯政權而家打壓嘅暴虐同埋佢嘅不合理。咁所以我覺得去到今日，我哋過去1年咧嘅工作，的確係做得相當之順利啦。但係政權嘅打壓都係無日無之，而我哋去到今日，去到一個立法會選舉今台，我哋就係要將我哋嘅信念喺呢一度咧，就繼續同香港市民講，亦都呼籲香港市民唔好放棄啦。
你會唔會演繹做各位選民你應該講會參與初選嘅朋友，請投票俾我，俾人。
我究竟投唔投票俾你咧？
唔係，但係大家其實會預計到好多我哋候選人會被 DQ。我咁樣講係因為我誠實，我哋會見到政府佢嘅打壓一定係好猖狂，我哋都冇需要好似紅的裡面咁講，就係唔好大家出面一切正常。 但係香港市民去支持香港人嘅信念，支持候選人嘅信念咧，係唔應該被 DQ 係抹殺咗。所以初選嘅意義唔單止淨係講我哋啲人裏面到底邊個係要參與今次立法會選舉，更加重要就係選民，你哋所有香港人喺而家冇篩選嘅狀態，你要信任你嘅政治代議士，你要揀一個政治嘅代表，你會揀邊個？呢個就係初選嘅意義。
好，時間都差唔多啦，係嘛？我哋而家抽第2位接受嘉賓提問嘅參選人，跟住係許智峰。
好，許智峰你好，頭先你就有提到話其實係要做呢一個議會抗爭，
寸土必爭，做到盡。
係啦，
冇錯。
你所指嘅寸土必爭做到盡係咪即係投棄權票？
寸土必爭做到盡係無論喺議會嘅抗爭，喺街頭我必出席，同埋喺所有嘅法律訴訟、法律程序我都做到盡。
咁會內咧，再講清楚。係啦，我哋而家淨係問緊你議會啫。
議會內，我反問大家，即係覺得議會仲做到幾多呢？如果你想問我棄權票係咪？嗱，棄權票呢，我哋要睇咩政策。例如點解過往我哋投個棄權票好典型嘅，就係我哋支持政府派錢，我哋叫到口水都乾埋。政府終於肯派啦，但係派嗰4000蚊呢，派到係一鑊粥。咁所以我最後點樣支持得佢落呢？咁呢個係其中一個例子咯。
但係好簡單嘅，即係有。既然你都已經係你成日講棄權等於反對嘛，咁點解你唔直接反對？即係點解仲要係留一個好似係喺中間嘅一個尷尬又或者係曖昧嘅位置？嗱，我又唔支持又唔反對咁樣咧，其實係咪你哋抗爭意志唔夠堅定啊？
我唔同意嘅，即係對我嚟講，如果一樣嘢係我要反對嘅，我會夠膽大聲講我。但係正如翻去派錢嗰個例子，我唔係真係想反對佢派錢啊嘛，我真係想佢做得好啲啊嘛。
例子嘅喎，即係譬如最近咁投棄權，呢個係咪你嘅個人意志咧？
議會好多嘅策略嗱，如果張舉能嗰個議案上面咧，我唔想嗰條提出到嚟淨係泛民主派或者民主黨反對張舉能任命，因為對於
有咩問題？因
為對於張舉能嘅任命，大家香港人嗰個質疑其實同我都一樣嘅，大家都可能好多嘅唔信任。但係我更加想調，我哋香港嘅法治垂危，我哋係警惕緊。係政權或者警惕緊司法機構，佢哋要做制衡嘅角色，佢哋要服務嘅係公義，
等等先，
係政府。
即係你覺得民主黨投棄權票係可以令到人哋感覺到嗰一種而家香港嘅司法備受質疑，而投反對票係冇。將個焦點翻喺唔係淨係睇張舉能一個人，即係對我哋嚟講，嗰個議案係成個我哋對法治嘅闡述，我哋要提醒政權同埋司法機構要做啲乜嘢。而唔係正正我哋針對一個人，我唔信你，嗰個意義要廣啲，要闊啲。 但係張舉能當日咧，其實就即係全盤接收咗釋法，然之後就撈 DQ 嘅一個法官。其實好簡單直接去反對呢一個人成為香港司法機構嘅最高嘅一個法官，其實唔係應該直接就反對咩？仲兜咁多圈做乜嘢咧？其實
我覺得有更加重要嘅信息，即係法治。我哋嘅闡述係啲乜嘢？做私人檢控、做民事嘅訴訟，我仲係喺呢個制度裏邊寸土必爭緊。即係我覺得我哋實際做啲乜嘢，多於話其實你反對張舉能多啲，我反對張舉能少啲，你投棄權票好啲。對我嚟講，我哋超越咗呢個討論。
好，我問私人啲啦。咁你喺黨內邊應該都有討論呢一個投票啦。你有冇爭取不如我哋民主黨投反對票，定係你係完全 follow 民主黨嘅旨意嘅咧？
我哋大家喺黨裏邊嘅個討論其實都幾一致嘅共識，因為民主黨喺回歸咁多年都未試過喺呢個議案係投支持。今次我哋就要破格。
而家咁多年就係香港已經咁下沉到咁樣，仲係跟以前過去咁未投過另外一啲票，咁呢一個思維，你點樣令人信服你嘅抗爭派？
我哋正就係第一次即係破格嘅做法嚟㗎啦。
即係破格就係
你哋嘅
本身係投
棄權，
我哋
外界希望嘅破格咧就係反對，係咪你哋仲候緊民意好多咧？
我覺得留翻俾公眾去判斷咯。嗰日我哋投嘅棄權定係反對，我好清晰話俾公眾知道，我哋對呢個制度或者對張舉能呢位法官，我哋係抱有質疑嘅。但係我哋更加想嘅闡述係乜嘢？
好，我跟住咧就抽第3位係接受2位嘉賓主持質詢嘅人，袁嘉蔚。好，行過隔離就得啦。
小心啊！好，袁嘉蔚比較 technical 啦，傳聞就係話你係羅冠聰嘅 Plan B 啦，咁原則上 Plan B 就未必係參加呢個初選啦。如果係眾志其他區嘅情況，亦都係派一隊嘅啫。咁如果羅冠聰被 DQ，咁你係 Plan B 咧？到底？
我必須講就係我今次嘅出選咧，係一個以獨立嘅身份去 去出選呢次嘅初選嘅。我覺得喺DQ 嘅問題上面，我哋唔應該俾政府不停咁樣去政治操弄住我哋。我哋越怕 DQ， 大家就會越將佢條線越壓越後。所以我哋今次行出嚟呢次嘅初選，就係話俾大家知，我哋要攞35家，呢35家入面就係最堅實嘅名單。嚟緊9月光復立法會。
咁即係話袁嘉蔚係羅冠聰 Plan B 一個謠言或者錯誤係咪？
我必須承認咧，就係呢一件事咧，喺而家呢個階段上面咧，我係個獨立身份出選嘅一個候選人嚟嘅，所以我哋唔好再糾纏喺 Plan A、Plan B 個話題上面啦。因為講緊條紅線，政府擺到幾多度㗎？而家目前我哋最專注嘅就係完成呢一場初選，呢一場初選就係要民主派共同一致咁樣協調出最好嘅名單。
我哋慳少少時間，你頭先講咗現階段呢3個字，現階段你係一個獨立候選人，係咪即係你唔排除下一個階段你咁嘅話，而家初選投俾你嘅人係咪俾你呃咗？
我會覺得喺而家呢個世代咧，每一個民主派嘅候選人都要願意隨時去補上任何嘅位置，唔單止係我，包括在座咁多位。
咁你嘅路線係咪同眾志完全相同？你係可以完全補上，或者你話任何候選人咁，如果你要你補上其他派別嘅，你願唔願意呢？
咁呢個當然要到時就同大家再磋商同埋再傾啦呢樣嘢，因為而家講緊係要知個嘅。前人嘅意志去做其他嘅事，唔能夠我而家喺個論壇度好啊我 OK 我應承啊，而係我哋民主派最需要一樣嘢就係策略，就係 be water。呢場運動就係教到我哋無論咩時候都要保持適當嘅靈活性同埋韌性去面對一切嘅難關。
我要演繹下你嘅説話，即係你其實唔排除你其實下一步可能會變成第二個人嘅 Plan B， 嗰個人係邊個而家？
先知咁我初選係投唔投你啊？
初選我就係覺得呢樣初選十分之重要嘅，其實就係俾大家喺冇篩選嘅情況底下揀出自己心水嘅候選人，選出最堅實嘅名單。嚟緊9月光復議會就係咁簡單。
即係而家呢個階段你可以做 Plan A， 下一個階段你又可以係 Plan B， 然之後咧就係啦，你哋同眾志嘅朋友咧嗰個走向都比較近嘅，咁啊甚至可能宣傳等等都有啲接近，會唔會太大貪咧？即係如果初選選到我2個，如果俾人 DQ 1個咧，我仲有個後備。係咪太過貪心咧？呢個做法？
我覺得呢個問題其實係回歸翻就係點解呢個時局會變得咁快？點解政府會不停咁樣喺度變嚟變去？我哋香港人就係要 be water， 就係要因應變去嘅形勢去作出自己嘅身位。
好，我哋跟住睇下第4位提問嘅參選人係徐子健。
你好。徐子健，我見你成日都話自己係素人，素人都講咗好多年啦。到底素人嘅定義係乜嘢咧？
你話講咗好多年素人啊，而家嚟講都係一個好老嘅素人啩。咁你話素人嘅定義，咁我相信可以講係冇加入任何政黨。
問題啦，你覺得？
其實自己對於黨派本來係冇個邏輯，點解香港嘅政黨變得好奇怪？一陣間可以大家自由搏擊嘅。
具體啲講下。
啱啊！你哋都講咗啦，有啲政黨如果佢哋投票嘅時間會投棄權票啦，加減乘除有晒啦嚇，即係淨係贊成。
咁素人就唔會投棄權票咧？
我諗如果作為素人嚟講，唔係講緊會唔會棄權票，而係我哋會有堅定意志贊成定係反對。
我投你㗎嘛，你之後4年投反對定贊成有咩議案我都唔知㗎喎。
你嘅意思係？
即係你而
家就話我有冇同呢個嘅選民溝通翻，我會投咩票，還是係點樣咧？
即係你話投你，因為係素人嘅身份，所以冇黨嘅包袱，所以投。
或者會咁講嘅，即係如果支持得我嘅朋友，佢會關注我嘅情況啦、走向啦。咁我會點去投票？我會支持或者反對一啲嘢，我唔會話自己控制晒去做噶嘛。我會諮詢我哋嘅選民噶嘛。咁我先會根據佢哋意見去做噶嘛，肯定會。如果佢哋同我意見相左嘅時間，我咪解釋翻俾佢知點解我會咁做咯。
我想問下在座位候選人有邊位你覺得係素人？
我諗會咁講嘅。其實楊雪盈啦，咁佢同我都極之相近啦。
佢都有佢嘅團隊嘅喎，灣仔協係組織啦，唔係黨啦，咁都係
地區組織係。
係地區組織就係仲係素人身份嘅。
或者我哋加快少少個組。你覺得阿梁晃維同埋彭卓棋係咪素人？
一半一半咯，係。
點樣一半一半？
一半，因為佢哋好早接觸政治啊，同我唔同啊。
你做咗
我係界區議員咯，佢哋好早接觸政治嘅。
就唔係素人啊？
唔緊要，當一半半啦。好咁。
杜汶澤係咪素人咧？我想問。如果佢參選嘅，
我相信係啩。
我都係嘅。
咁啊，多粒一樣嘢，即係你覺得你同阿彭卓棋同阿梁晃維，大家入去投反對票有咩分別啊？咁點解要揀你？
你嘅意思係話點解要
3個入到去？我想
都係投反對票，點解要投你咧？
我將講法先啦。如果係因為近 點解我要揀我？其實呢啲問題呢度8個人都會面對同樣嘅問題嚟嘅。而家揀我哋嘅原因就係希望透過今次嘅初選，等市民揀佢哋認為最合適嘅人做代議士，等到我哋喺立法會裏面有過半啊嘛。而呢個做法就係要我哋表現到究竟我哋可以做到啲咩嘢，我哋過去做過啲咩嘢。
你做到嘅嘢同梁黨嘢分別咧？
嗱，同埋佢你寧願抗爭立場輸都唔肯
我要左定右，我答對。
一樣啫，都係點解要信你？點解要？
答過你先。立場書啱啱係2點鐘到寫。立場書寫得我覺得比較怪，咁我用翻我自己嘅方法演繹翻出嚟，可以請睇我 Facebook。到呢邊。點解要？
既然大家都差唔多，點解我唔揀個後生嘅咧？而家抗爭係年輕人嘅事喎，
有少少年齡歧視喎，
可能有。
嗱，講翻呢樣嘢，我好相信一樣嘢，抗爭唔係一個年齡層嘅事，可以係啲比較中年人嘅事，甚至乎係老年人嘅事。如果大家認同嘅話，我相信以我年紀可以有我智慧去幫助大家去做，去幫助大家去抗爭抗衡呢個不義嘅政權。
好啦，跟住呢邊幾位候選人未出過聲啊，睇下跟住第5位係邊位啦？鄭達鴻。
好，你嘅口號就係越打壓越頑強，但係最近即係政府委任張舉能啦，為下一任終審法官啦。咁你哋公民黨咧係投支持，亦都有棄權。咁呢個就係你所謂嘅越打壓越頑強啊？
首先要解釋翻成個議案啦，其實喺即係呢個張舉能嘅任命嘅時候咧，即係我哋係對於張官呢個人有保留嘅。咁但係一直以嚟我哋係崇尚三權分立，而呢個張官嘅任命咧係由呢個司法人員推薦委員會出嚟嘅。咁而呢個委員會2年前係做過咩咧？就係去令到外籍一啲比較開明嘅法官啦 ，Lady Haley 啦，咁同埋即係麥勒連啦，加拿大籍嘅都可以嚟到香港。咁所以咧，我哋係即係希望保障到我哋嘅法官係不受干預。而如果我哋可以保障到呢個制度嘅話咧，其實唔會啲建制派淨係 endorse 一啲藍絲嘅法官入到去呢個即係法庭度。
其實你都講到你好支持啦，咁如果你入到議會，你究竟會跟郭榮鏗投支持票定係棄權票咧？
我諗即係郭榮鏗本身同埋大律師公會啦，同埋律師會有溝通，因為本身呢個司法人員推薦委員會咧，其實係有晒大律師公會啦，同埋律師會嘅代表喺入邊嘅，咁所以即係我互動啦。咁而至於我係直選嘅代表咧，亦都係會投棄權票嘅。
其實你哋公民黨咧，一黨兩投，甚至以前嘅醫委會改革一黨3投，支持係投晒。你自己個人嗱，你未做法，你可以話我未入議會啊嗰陣時，但係你都係黨嘅一員啦。咁你點睇嘅黨咧？
我絕對唔覺得呢個黨係鬆散啊！首先，因為我哋喺嘅議會抗爭嗰度，你會見到我哋好多嘅議員啦，都係做緊應該做嘅嘢。譬如你郭榮鏗喺內務委員會做咗主持咧，已經係半年嘅時間。郭家麒正係因為抗爭咧係被捕。
我要打一岔，抱歉。一個黨有3個唔同嘅投票取態都唔叫鬆散，咁叫乜嘢？
我要睇翻成個情況，你講緊嘅應該係已經係上屆嘅事啦，今屆
上屆都係一個黨，你哋係同一個黨嚟㗎嘛，冇
一個黨有2個投票取向，咁又點樣？
頭先我簡單解釋咗俾你知，就係因為要跟翻個制度，我哋係尊重個制度，但係當個制度去任命一個人係有問題嘅時候，我哋都會去保留，希望佢可以警惕。
即係所以你叫做2條腿行路啦，你哋公民黨又有投支持，又有投，即係防止街外嘅攻擊啦。
其實最緊要係咩？最緊要係就係咁多位選民咧喺次嘅選舉咧出嚟投票，初選出嚟投票，我哋達成咗民主。
我哋而家係講緊，我哋而家係講緊，我哋就講緊選民嘅投票。係啦，同埋你頭先講到話，如果公民黨喺張舉能議案入邊投棄權票，就某程度上同埋郭榮鏗嘅贊成，就係可以即係維護到個制度，會唔會太天真同埋睇得自己太高？
我又唔覺得睇得自己太高，因為即係頭先都講啦，即係2個外籍開明嘅法官 LGBT friendly 嘅法官都係因為呢個制度先可以嚟到香港。如果我哋今次否決嘅話，其實未來任命嘅建制派任命嘅可能只係藍絲嘅官員，藍絲嘅法官。咁所以我哋要杜絕呢樣嘢，咁所以先有呢個咁嘅取態。
即係你覺得其實即係建制派係會參考反對派或者民主派喺個投票入邊嘅取向，佢哋都唔係反對，我哋都唔好意思反對。你真係覺得佢哋會咁樣做？
呢個如果佢唔敢做嘅話，佢係要面對一個即係完全崩壞，即係令到法治崩壞嘅一個情況。
你覺得佢
咁同時間國安法嚟緊啦，咁就係咧就由呢個特首咧完全委任法官，咁呢個咧絕對唔可取嘅。
咁既然都特首完全委任法官，咁你頭先講嘅司法推薦委員會就更加已經俾人係架空咗嘅時候，咁你頭先所講嘅你投棄權票嘅理由咪更加下站唔住㗎？
我都真係唔係覺得站唔住腳，因為你嘅早上啦，其實都有一個去 pay for 嘅一個法官啦，係成為咗常任法官，都係因為呢個司法人員推薦制度本身係應該冇問題，但係有問題嘅咧就係我哋冇民主去 back up 呢個法治嘅制度，咁所以先有最大問題。
而你覺得你哋嘅棄權票係 uphold 到呢一樣嘢嘅，竟然？
我唔覺得完全 uphold 到，但係我哋要尊重翻個制度，取民主去保障翻個制度。
好啦，我哋睇下跟住落嚟啦，下一位接受提問嘅參選人呢，係楊雪盈。
楊雪盈你好，頭先你講就希望大家可以發光，咁即係我想問，即係咩意思？完全聽唔明。
可能我文化人嘅出身啦，咁我就希望咧，我哋香港人咧，其實喺舊年嘅運動啦，或者再之前，其實我哋每一個人都有自己嘅角色，有自己嘅能量。咁每個人就好似發住光咁樣咧，就算係咁崩壞嘅環境之中，我哋都見到彼此，我哋都可以同大家一齊上。
即係大家做好自己嘅崗位等等啦嚇，咁關你做議員咩事咧？
我覺得我嘅角色最緊要嘅一樣嘢咧，就係聯繫住唔同嘅人、唔同嘅地方、唔同嘅體。咁做議員咧，其中一樣嘢好重要嘅咧，就係我哋可以有組織啦，人哋知道我哋嘅堅定嘅意志。咁自然咧，我哋就會係物以類聚，人以群分，可以同我哋好多嘅手足一齊，係我哋喺呢場運動裏邊咧做到幫到大家嘅事。
即係你想連結啦，但係連結呢個部分就真係要質疑下你。頭先網民都講過，你好似連灣仔區議會有個講法啦，就係話連自己啲區議員都管唔掂。另外一個咧就係大家都見到嘅例子咧，就係之前18區嗰個聯席會議咧，上邊即係其實你當其時係一個主持啦，下集人係結果搞到係一鑊泡嘅，竟然係全部民主派議員一齊開會咧，但係結果係嘈大交嘅。你覺得你連自己嘅區議會同埋18區區議會都連結唔到，你點解發光咧？
首先我哋覺得區議員咧其實係有獨立嘅意志啦，灣仔區唔係受邊一個去管，冇呢一個從屬嘅關係。
市民同埋公民團體都冇嘅喎。
大家所以咧，我嘅意思係要連結大家，大家係平等嘅。咁去到呢一個17區，其實我哋好史無前例地，我哋召集咗300幾個區議員喺同一個空間，同時同地為咗反對國安法而開會。咁中間民主嘅過程裡面一定有討論，可能有時會嗌得比較面紅耳熱，但係我哋都會係處理到嗰個嘅議程。我哋希望咧能夠讓足夠嘅時間俾各位議員去睇到相關嘅文件。咁所以咧，可能中間咧程序上面咧，大家會有一啲嘅唔同嘅爭拗。
似乎與會嘅人唔滿意嗰個係你個處理方法。佢哋係直頭將個矛頭指向你，覺得你做得唔好。
咁我相信呢一啲都係可以即係討論同埋改進啦。咁作為喺呢一屆嘅區議會裏邊，咁我有幸成為主席，都係承住民意。咁當中都有好多不善嘅地方，其實咧我哋明白，亦都係咧會去不斷去將佢改善，靈活應變就正正係我哋而家香港要改一個技能。
其實啱大家即係叫做光復咗，即係本來係紅區嘅灣仔區議會啦，應該要好好地把握做好啲區政。時間你又係灣仔區議會主席啦，你又係嗰個聯席嘅召集人啦，你兼顧咁多嘢，會唔會幾頭唔到？你只譬如好似韓國瑜咁，佢啱啱選完市長之後咧，去選總統會俾人罷免。咁你自己其實見到今屆喺呢個各個名單入邊，唔係好多區議會主席嘅啫喎。
首先就喺韓國瑜嗰邊啦，咁我就冇講過。咁但係咧，我覺得重要嗰樣嘢咧，就係我哋有冇喺唔同嘅崗位嗰度。正如其實我剛剛就卸任咗18區輪任召集人啦，因為其實係18區嘅正副主席去輪替。咁我亦都唔希望兩者係會有一個重疊嘅時間。而我嘅政綱裏邊咧好清晰，就有咧一個聯繫兩級議會，讓區議會咧都能夠匡正翻佢自己嘅職能，可以係為民意去發聲。因為區議會實在係我哋一人一票直選出嚟嘅一個架構。咁我希望咧，即係除咗係藉住區議會係讓更多市民係實踐到佢哋嘅民意之外，去到立法會，我哋亦都
我明你意思，唔好意思，我哋要打斷。咁即係話在座其實任何一個區議員都做到同樣嘅功能。
可以一齊做。而其實今次35+最癥結嗰樣嘢係啲咩名單？我哋要說服到更加多嘅香港人，佢哋嘅光譜我哋完全一致，所以我哋希望呢一個名單上面咧係能夠有唔同嘅光譜嘅人集合。
所以唔一定要係你，同埋可能揾個目。
我覺得最緊要嗰樣嘢就係喺邊一個位置最幫到香港人。
其實唔係好明嘅，不過唔緊要。
好啦，跟住落嚟啦，我哋抽埋尾二一位梁晃維。
梁晃維你好。頭場白嘅時候都講咗好多本土派啊、香港民族啊， 即係我哋唔係話要跟住官方嘅説話去走啊。咁但係呢啲咧，如果我哋用 DQ 標準咧，幾乎係一定會死嘅。你同唔同意啊？
我唔同意啊！其實我係提出過即係本土理念啦、香港民族理念等等嘅字眼，而最終咧呢個選舉主任咧係信服咗我嘅答案咧，係俾我入閘㗎。
你當其時嘅答案咧，你覺得點解會可以過到關？而家個形勢完全唔同，個國安法都嚟緊，你仲係覺得自己係應該過到關，定還是你同頭先阿羅冠聰嘅答案都差唔多？其實我盤死嚟選嘅啫。
我絕對唔係一個盤死嚟選啦。如果我最後真係俾政權，一定係一個政權一個不義嘅手法，而係我多於我自己本人係特登做啲事情去駁佢 DQ。因為我更加相信嘅就係其實嚟緊今次初選入面有個好重要嘅意義，就係我哋能夠喺一個冇篩選、最接近民主選嘅情況之下，投選大家真正相信政治理念啊嘛。理念希望係喺港島區呢個地區入面係有人能夠代表到本土派、代表嘅人嘅聲音，所以先至決定參加今次嘅初選。
你會唔會有少少痴心妄想啊？即係覺得自己今次過到關入到閘？
咁其實講真，其實今時今日喺國安法通過之後，其實都有好多唔同嘅建制親共政權都講到明話，好有可能咧會成為咧即係反對國安法呢件事，好有可能已經會成為 DQ 唔同候選人嘅紅線。如果你咁樣計嘅話，其實在座每一日嘅。咁如果我哋每一日都去驚就係話，我講完呢啲説話會唔會令到我哋入唔到閘嘅話，咁我哋香港人其實係唔敢講。
我想問你頭先你話本土係香港嘅未來，你可唔可以舉好多種本土咧？你係邊一種本土？
其實我自己講所謂嘅本土理念咧，就係我哋願意相信就係香港人係應該要視香港係唯一一個我哋能夠安身立命嘅地方，因為而家我哋見到喺國安法嚟臨嘅時候，又聽到唔同嘅
繼續講本土派先。咁好多在座嘅都可以話，就算冇話自己係本土派，都做到你。
我諗我哋最大嘅分別就係我哋可能對於我哋同中國之間個關係態度，即係仍然會痴心妄想，就係覺得中國係會變好，中國會民主化、會改革。然就係我哋嘅理念好清楚，就係我哋視中國為我哋嘅敵人。我哋知道中國係一定會用盡佢所有方法繼續壓迫我哋香港人，而我哋面對咁嘅壓迫，我哋係一定唔會退讓，我哋一定會再次。
同埋現任嘅議員之中，有冇一個代議士係代表到你而家嘅路線？
歷屆同
歷屆或現屆咯。
曾經有嘅，不過呢一啲代議士最終咧都係俾人哋 DQ 咗。
咁係邊位咧？即係我要問咧，因為我唔係好清楚你嘅路線，我希望揾到一個同你 similar 嘅，所以我可以決定。如
果你真係要我揀一個嘅話咧，我相信當年嘅梁頌恆同埋游蕙禎都係其中一啲咧係能夠代表到我信念嘅候選人。咁我當年喺上一屆立法會選舉入面咧，我都係投咗俾佢哋個選舉聯盟。當然可能就住一啲細節上面，我哋會有所不同。咁但係起碼一個大體上嘅理念咧，而
你仍然覺得自己應該有機會係唔俾 DQ 嘅，不過都唔緊要啦。另外一樣嘢，其實你有份發起嗰個抗爭派墨落無悔。其實嗰啲本身嘅內容咧，似乎喺地區協調嘅時候，大家都已經係同意，而且好多黨派都有口頭承諾。你咁樣做其實係咪喺度夾緊其他人？
我想講就係，如果大家都係承諾咗，或者係都認同，點解唔能夠係一個公開向住全香港市民做一個公開嘅承諾咧？咁而或者任何
翻轉問，既然佢已經公開講過，亦都已經大家私底下 agree 咗，點解又要簽多張嘢咧？
因為我哋就係知道我哋有啲人可能係即使今日喺個初選嗰度協調咗，初選會嘅內容係冇人知道，就係得戴耀廷教授同所有參與呢次初選會嘅人先知道㗎嘛。咁其實任何人如果佢背叛佢嘅承諾，根本係冇人能夠保證。就正如事實上，即係例如喺新界西嗰邊街工協會入面嘅承諾，咁變相嚟講，我哋就覺得，既然大家都認同呢啲概念啦，咁點解唔能夠係真係做一個公開承諾咧？而我更加想講嘅就係，如果任何人係覺得因為見到呢個承諾而俾人夾嘅話，就不如諗下點解你會有個咁樣嘅 hard feeling？係咪你本身就唔同意上面嘅內容咧？
但係你嘅出發點係咪就係想夾佢啊？咁樣
唔係所有香港人係做一個清晰嘅交代，話俾人睇喺初選入面投選嘅候選人都係一班咧係具有堅定抗爭意志，願意喺制度內外喺未來4年入面代表你哋同政權全面搏鬥嘅人。
簽張紙就係堅定抗爭。
簽張紙係一個基本嘅責任，但係若果我哋連一張紙都唔肯簽嘅話，就更加係唔能夠向選民交代到底我哋會唔會繼續堅定抗爭。
舉例，而家有冇邊一個議員做咗啲乜嘢係你覺得違反呢個全面抗爭？
違反全面
即係可能你個抗爭書裏邊好多內容㗎嘛，有冇人係做過？
你嘅意思係喺上即係而家呢
一屆、歷屆或者
現
現屆啊？
對於我嚟講咧，就係對於當年咧，即係上年嘅7月1號或者係2016年嘅旺角事件當中，有好多嘅立法會議員咧係衝出嚟咧，係同一啲勇武嘅示威者割席。對於呢件事，我係極度失望，亦都覺得係唔合乎全面抗爭嘅原則。
明白。
咁啊，留翻一間你同阿許智峰同阿徐子健再去辯論，你係咪夾緊佢哋？因為佢哋冇錢。
喂，徐子健我啱啱簽咗
啦。
最後
用另外一個方式。
用方法係。
好欲罷不能係嘛？
係。
我哋最後一隊團隊就唔需要再抽啦，彭卓棋嘅團隊。
你哋好。
好意思啊。
好。咁我都見你都係即係比較勇武啦嗰一類啦，都會出去街頭運動啦，有甚至被捕啦。咁你同其他嘅本土聲稱本土派或者勇武會有乜嘢最大分別咧？
我諗現在最大嘅分別，我哋係一個區議員先啦。我哋係積極係利用區議員嗰個身位，希望可以用區議員嘅身位去支援即係被捕手足。咁過去多場嘅被捕濫捕嘅事情，我同我嘅團隊都係多次都係去盡我全能努力去即係去咁呢一啲，我諗係同其他人嘅一啲分別啦。
即係就因為你係區議員嘅身份。
我諗始終我哋區議員嗰個身份咧，有時我哋落到現場，我哋盡量係希望即係同啲警察去理論，佢啲執法部門，因為佢哋係濫捕啊嘛。咁所以你見到不論係我又好，即係我諗身旁嘅立法會議員許智峰議員，希望即係喺呢個過程中係盡量可以一個拉鋸嘅理論，希望爭取多啲空間嚇。
咁你似乎同梁黨委有差，
係啊，差唔多。
大家都區議員。
有少少唔同嘅。
咁個唔同喺邊？
咁我會認為佢就即係講到明，即係講一啲即係話佢認為香港民族嘅嘢啦。咁其實我係認同嘅，但係我會將個字眼係會再擴闊少少，就做呢個嘅本土尊嚴價值。相信而家喺呢個國安法嘅壓境嘅情況下，其實共產黨就係貴，而家我哋就唔貴，所以我係認為我哋係捍衛緊我哋本土人體。
會唔會仲虛啊？即係香港民族都叫做係一個俾人攻擊緊嘅稻草人啦嚇，明白嘅一個 term， 香港尊嚴價值即係。
我覺得本土
本土先。
咁我認為咧，本土即係其實大家都啱啱問咗好好嘅問題，何謂本土派？即係 OK， 泛民就好清楚啦 ，OK。但係本土派嘅意思，我自己個定義嚟講就係話，應該係捍衛香港人嘅核心價值，譬如我哋係尊重即係自由民主法治 ，OK， 我哋捍衛廣東話，我哋要本土嘅經濟本位行先。譬如我自己亦都喺我政綱提出，因為我亦都係喺畢業之後我都係創業嘅，我希望即係一產業去第三產業係可以建立到香港嘅品牌再輸出。
用呢個 definition 嘅話咧，而家52個報名嘅參選團隊應該全部都係本土派。
係啊。
認為本土派都係嗰句，喺個過去泛民主派嗰一定未必係本土派咯。
或者
即係你用個名，你只係用個名去分開，哦，因為你係泛民，所以你就唔係本土。但係如果用你頭先嗰啲定義嘅話，我相信冇人會反對㗎。
或者答翻 Erica 問題啦，有啲乜嘢唔係本土派？咁就喺過去投票記錄有棄權嘅 ，OK， 即係講緊係有啲嘅本土嘅權嘅，包括最近張舉能法官呢啲有份棄權嘅，我都認為呢啲不是本土派。但係我認為今日有初選，最主要就係大團結，所以我今日都落物太多，但係我希望就係呢啲位置係有是其是非其非，黑白。所以點解我哋嘅團隊又設計好，甚至我哋嘅衣着黑白分明。
你係咪可以肯定你以後嘅議會嘅投票啦？即係如果關乎香港啦，所謂自由法治啊嗰啲議題，係一定唔會同建制派投相同嘅票？
如果有一日我哋推個議案 ，OK， 係講明係香港人優先，咁如果建制派保皇黨，
如果係反對23條咧？
反對23條，梗係堅決反對。
你個團隊裏邊咧有一位就係反對討論23條喎。
嗱，我呢度亦都係一個好好嘅機會澄清，幫我哋嘅同事去澄清。當日即係議員喺個區議會裏面，佢哋係堅定地係反對23條。
但係佢哋同謝偉俊投一樣嘅票。
只因為個程序問題，轉頭我亦都會問阿楊小姐嘅呢個問題 ，OK？ 因為個程序嘅問題，我哋係執着於程序公義，所以佢哋先有呢個嘅説法。
但係最後嘅結果
你執着程序，你反對一個反對23條嘅議案。
當天我哋嘅團隊，佢哋嘅意思係話，因討論係有一個程序嘅公義，應該係個過程，應該係諮詢晒大家。但係當天嘅事實就係咩咧？楊雪盈小姐將呢個議程打尖擺咗上去。
係咁，點解唔投棄權？
咁呢樣嘢其實好簡單，就係話你要同民主派去傾啊嘛。我相信大家在座咁多位，你喺佢嘅公開言論係咪啊？大家係旗幟鮮明反對23條。我而家問你張嘉莉，你反唔反對23條？
堅決反對23條。
咁你呢個技術性嘅解釋，咪同解釋點解佢哋棄權同埋贊成張舉能唔一樣？
嗱，咁樣講啦，當天都係嗰句，我哋係執着於嗰個程序個問題 ，OK？ 因為程序公義，程序當然緊要啦。程序嗱兩樣嘢不能夠攞埋嚟講，因為嗰日我身旁嘅張嘉莉議員都表明咗，佢係堅決反對23條。咁佢根據呢個嘅意好，或者係佢公開嘅言論好，甚至在各旁邊佢都係堅決反對23條。我希望喺民主派嚟講，大家係有目共睹。
我投嘅票係冇支持23條，我冇投呢個票。
若果一間你哋自由辯論嘅時候，許智峰同埋鄭大雄用呢個理由去解釋佢人咧係有質疑，但係佢哋只係對個制度有懷疑嘅話，你哋就好難攻擊佢噶咯，因為佢嘅思路同你一模一樣。
嗱，我想講一樣嘢就係張舉能嗰件事件咧係要旗幟鮮明反對嘅，
但係23條就唔需要。
23條梗係旗幟鮮明反對啦，
但係就唔需要喺投票度反映出嚟。
都話當天係一個程序嘅問題，係好清晰嘅，係因為個程序問題冇諮詢我身旁嘅 議員，導致佢哋反對緊楊雪盈嘅決定，並不是反對緊並不是反。
咁睇下你嘅選民係咪咁樣睇啦？
好啦，我諗嘉賓提問嘅時間咧，多謝兩位啦，袁利明同埋林彥邦連珠炮發同埋寫近嘅交鋒啊！好啦，跟住落嚟咧，我哋有自由搏擊嘅時間。自由搏擊時間，每隊有3分鐘嘅主場時間，可以任意提問。咁你可以問一個人又得，3個人又得。咁但係就3分鐘時間裏邊問完啦。自説自話嘅時間太長或者議題重複得好緊要咧，咁我作為主持人咧都可能會介入㗎。好啦，咁次序方面咧，我哋就調翻轉嚟啦。咁首先咧就係由袁嘉蔚開始，請袁嘉蔚。
係，首先我想問鄭達鴻議員嘅。係啦，好多機會啦，俾你去解釋點解公民黨喺啱啱去舉能為首席法官嘅一個議案上面，公民黨嘅投票取向不一。好啦，今日咧簡單問你，若然你在席的話，你會投乜嘢？支持、反對定棄權？
我諗你要睇翻成個議案啦，張舉能議案我亦都講得好清楚，就係因為佢係根據呢個司法人員推薦委員會，而呢個司法人員推薦委員會咧，傳統上特首係連特首都冇權去委任嘅，咁所以尊重翻個制度。咁但係我哋對於張舉能呢個人咧係即係有保留嘅，咁所以我哋會根據翻。
直接啲，你會投支持、反對？
會投棄權票。
OK， 明白。我淨係想提，如果民主派連投一條反對票都搖擺不定咧，其實我哋真係好難去說服公眾。民主派其實應該要有最頑強、最堅定嘅民主派。我好希望就係嚟緊5屆嘅民主派咧，都必須要同我哋議員係一齊去抗爭，同我哋抗爭者一齊去抗爭，先係35+背後嘅精神。如果唔係有一條絕世好橋都冇用嘅。跟住我嚟想問下 Michael 㗎，我想。Michael， 我哋都係年輕人啦，又係南區區議會嘅同事。咁你對過往嘅議會政治都好有睇法。我想問你點樣去回應啱啱鄭達鴻議員嘅睇法，以至你覺得議會裡面你係想做啲乜嘢呢？
嗱，其實過去民主派即係或者泛民主派面目模糊咧，就唔係低溫嘅事。過去簡單用張舉能呢個例子，我就一定會係一投反對嘅。呢一個係一個唔尊重人民嘅政府，而呢一個咁嘅政府架構入邊嘅嘢，我哋做乜要尊重佢啫？佢侮辱我哋當然要投佢反對票啦，唔需要俾面佢。第二樣嘢，對於抗爭嘅路線裏面，除咗議會抗爭之外，我哋今場嘅選舉要達至35+，我好希望每一位在席嘅人士都會關注香港島特別嘅選情，因為香港島會出嚟界票，佢哋唔會贏。但係佢會令我哋輸，所以過去啱啱我都想問下 Erica， 不過 Erica 行開咗啦。到時我又都會俾佢，唔該俾阿袁彌昌，俾埋佢阿嫂簽呢份嘢。呢份嘢咧，我完成任務。
袁嘉蔚仲有時間，有冇問題？
咁如果係嘅話，都想問埋 Fergus 啦。Fergus， 你作為一個素人啦，亦都係我哋即係新進嘅議員，你覺得點樣可以平衡到地區嘅以及係議會上面嘅工作咧？
其實我自己本人咧係中西區觀龍區嘅區議員，咁我諗過去咧都係好多人會質疑，就係到底我去出選立法會會唔會重演當年何秀蘭嘅事件？但係其實咧大家都要記清楚，其實當年咧何秀蘭喺出選立法會咧其實係落敗收場。變相嚟講咧，我認為我係兩者之間嘅工作，我亦都會有一啲咧係以一啲非常之出色嘅雙料議員為榜樣去學習。
時間到啦，跟住係許智峰嘅主場時間。
好，呢個問題咧，我想問下我身後面嘅阿聰羅冠聰嘅。咁因為反送中，香港人有好多嘅無力感。咁頭先我講到嘅寸土必爭啦，就係話你睇到即係無論即係好多官司我打緊，咁喺議會我夠膽去衝，喺街頭我都同抗爭者一齊啦。咁但係好多香港人都擔心未見到出路。咁我想問阿聰，即係如果你入到去議會帶領香港人點樣突，同埋你有咩個人嘅特質可以係即係同我哋之中係脫穎而出，係帶領到香港人嘅咧？
首先我都係必須要講我係非常之敬重阿 Ted 啦，即係過去我哋喺議會裏面一齊抗爭，但係好可惜我冇辦法喺跟住落嚟之後呢幾年係同你一齊喺議會裏面做無論抗爭定係肢體抗爭咧，因為我就係俾一個不義嘅政權去取消咗我嘅資格。咁但係如果大家睇翻我喺議會裏面工作嗰一年咧，其實就好清楚咁樣見到，我對於無論係議會裏面最仔細嘅財委會嘅審議每一個項目，佢有冇超支，佢有冇係吞食咗人民嘅民脂民膏，去到議會2047之後香港前途問題嘅人，再去到後面我哋喺唔同嘅議會抗爭當中咧，我諗無論係聽定係我咧，大家都會見到我哋嘅身影係團結一致嘅。我哋講今日和勇不扶戰線、議會、街頭、國際呢3方面，我都係有一定嘅經驗喺度。我係歷史上香港第一個去到美國 國情之民，聽總統去演說嘅人。我係曾經有因為參與雨傘運動有入獄嘅記錄，亦都係多次就係有好多嘅抗爭，有好多市民係見證住呢啲時刻。咁所以我透過呢啲經驗，我以往嘅公職咧，我都好希望就係能夠未來繼續可以喺議會裏面同阿 Ted 一齊共同進退，同埋好多唔同派嘅議員一齊去抵擋惡法。
好啊，咁我同樣嘅問題我都想問埋阿 Tiffany 袁嘉蔚，你有咩個人特質，同埋有啲咩好橋，俾香港人睇到係真係會有信心，可以行到出呢一步，我哋呢一仗係會贏嘅落去嘅。
呢個就係我今日坐喺呢一度嘅原因啦，因為點解我哋要參加初選啊？初選就係要為民主派協調一張最堅實嘅名單。如果唔係你問，如果民主派35+唔可以有一個團結一致嘅意志去抗爭的話，你俾一條絕世好橋我都冇用，因為議會唔係需要一個袁嘉蔚，係需要有35+以至更嘅民主派入到議會，同抗爭者一齊同行，一齊抗爭。
即係所以你係最重要，點樣團結到大家呢？
我哋過去見到呢場運動啦，無論議會、社區、街頭以及係國際線，我哋都係不可分割一路連線做落去嘅，所以我覺得其實喺唔同嘅領域上面，我哋都要堅持落去。
好，唔該晒 Tiffany。
10秒，仲有跟住到彭卓棋團隊3分鐘主場時間。
嗱，呢條問題我想問我身後嘅楊雪盈小姐嘅。嗱，咁呢度咧，我手頭上有一個灣仔區議會嘅防疫包席，咁啊當然啦，作為區議會主席去選立法會其實係有問題，我唔斟酌呢一樣嘢。我想問呢一個防疫包當時咧就最後咧係 claim 唔到錢嘅喺個政府，有啲團體咧最後淨係攞到6位數字，甚至要貼6位數字嘅錢出。個嘅失誤，當然你就話係 DO 啦 ，OK， 民政處啦，民政處打壓，字眼上面有打壓啦，話呢個係武漢肺炎啦，咁武漢肺炎當然就係我哋民主派用嘅字眼啦。但係我想問你有冇喺呢一個文稿出之前去諮詢或者去問所有灣仔區民主派有定係冇？如果冇嘅，你會唔會同灣仔區所有民主派嘅議員道歉呢？
Michael， 我諗你搞錯咗一個程序嘅問題，輪到為你中心去做呢一個嘅承包。咁佢哋以翻嗰個區議會嘅條例裏邊咧，其實佢哋亦都有一定嘅出版物嘅自由度。
我問緊你有冇出呢一份嘢之前諮詢你嘅同事呢？之前啊，有定冇
？Michael， 我哋已經咧喺第3次嘅區議會特別講埋落去，第3次嘅大會上面咧已經
等佢答咗先啊！
議會抗爭啊嘛，大佬。
諮詢過大家嘅議員。
又俾啲
嗰次咧係喺大黑幫做福利。
OK 嗱，我係咪加時啊？加翻時俾我而家。
佢有權答㗎，我可以請阿楊雪盈再講多2句啦，好唔好？我聽唔到佢講。
嗱，或者咁啦，我問一個問題 ，yes or no 就係咁簡單。點解我要問呢個問題就係嚟緊立法會，我哋民主派入到去35+有好多嘅抗爭嘅細節。策略，如果唔有一個溝通嘅基礎下，尊重嘅程序抗爭呢 OK？ 我哋南區區議會當時所有區議會都有大家自己協調。嗱，唔問你啦，
我哋嘅槍頭應該
真獨裁就假民主。我問佢啦，下一條問題，我而家想係問下一條問題，
爭取翻。
我而家問下一條問題。
問啦。
OK， 嗱，補翻時俾我啊，但係
好冇㗎。
OK 嗱。我另外一條問題其實就想問，即係鄭達鴻嘅 ，OK。咁啱啱我聽你講，你都認為法治未完全崩壞，咁其實你係咪仲認為喺個體制裡面同佢糾纏係啱咧 ？OK， 因為我哋現在係講緊最高嘅抗爭。你都俾時間我講啦，剩翻15秒，我就好簡單同你講，我哋唔會放棄法治，因為對於一員去到警署見到一個遍體鱗傷嘅手足，佢一定要盡快咁救佢翻嚟，呢個先係捍衛法治嘅最好原則。咁所以咧，我係唔會放棄法治嘅。
2秒時間。OK， 時間夠。提大家啦，如果即係答聲好厲害嘅話咧，烈，但係咧有陣時咧啲觀眾係會聽得唔清楚嘅，同埋咧我作為主持咧都會有責任咧係要俾翻被質有翻啲時間去回應問題嘅。好啦，咁跟住落嚟咧就係鄭達鴻嘅主場時間。
好，咁啊喺國安法嘅陰霾底下啦，好多家長同我哋表達擔心啊，話仔女少咗一個出路，咁所以我代表公民黨咧，向歐洲議會度咧係爭取緊一個救生艇嘅方案，希望保障埋冇 BNO 嘅後生仔女咁。咁啊問題係想問楊雪盈嘅。 咁啊喺歐洲時間6月19號夜晚咧，其實歐洲過咗呢個決議㗎啦，就係救生艇嘅議案啦。咁我同公民黨啦，其中一樣最重要嘅爭取就係希望可以豁免後生仔嘅刑事記錄，咁啊保護因為社會運動因為有案底嘅手足。咁所以我就想問一問你，對於國際戰線之前有冇任何嘅投放？可唔可以分享下你嘅工作呢？
我喺文化方面咧，係就國際線咧，其實都做咗唔少嘅功夫。我哋支持香港嘅藝團啦，香港嘅文化嘅組織啦，喺香港嗰度滋養啦佢哋嘅資源喺呢一度，亦都係我哋不斷係為咗佢哋去出去做，係喺文化政策上面咧，一路以嚟我用香港文化監察主席嘅身份咧，係支持住佢哋。咁或者好可惜嘅就係讀藝術出身嘅我冇辦法同佢哋一齊喺前線裏面做一個表演。
好，咁我都俾好多時間你啦，咁啊都好理解嘅。不過咧喺呢個咁嘅反送中運動啊，或者係國安法嚟臨底下咧，其實就到仔女嘅表達自由同埋佢自己嘅人身安全。咁所以咧，我哋先會向國咧爭取緊更加多嘅便利政策，尤其是去歐盟。譬如我分享啲我哋最近咧就喺神根區啦，由呢個逗留9年啦，亦都可以喺協調嗰邊嘅 NGO 啦，係俾多啲工作同埋求學機會。
梁大雄，請你問問題啦，好嘛？
咁所以我繼續想問你嘅就係喺你頭先就話即係都做緊啲國際上尊重，咁但係我頭先一開始聽你嘅開場白嘅時候又話即係喺你做灣仔區議會嘅主席咧，其實都係十分之困難喎。咁究竟你係會唔會喺度莊嚴咁承諾大家你會辭任灣仔區議會嘅主席咧？
首先做一位區議會主席嘅困難咧，其實係喺今次政權嘅步步壓迫之下，係18區都一樣嘅壓力。尤其是我以往做4年嘅區議會，我係以一敵12嘅姿態，咁我係好清楚咧政權啦或者建制派係點樣將我哋去壓迫。而我相信喺今次我哋呢一個選舉裏邊，其實做唔做主席並唔重要，重要嘅係我哋做啲乜嘢去幫到香港人。其中一樣比較，我想係
俾咗
多少少
15秒嘅時間你啦。咁啊，你頭先話做唔做主席唔重要，咁即係你做主席定唔做主席？
其實如果我哋有一個更好嘅崗位能夠幫到香港人，呢一個
因為咧嗱，我見到咧在座咧其實有7位都係區議員，甚至許智峰咧3屆議員咧都唔會做埋區議會主席。好多選民就係擔心你究竟有能力兼顧灣仔區議會同埋立法會議員嘅工作。
我哋可以分工。
好，時間到啦，跟嘅主持人時間。
係咁多位香港人大家好，咁啊頭先許智峰議員都問咗，我都想問翻你啦。其實我哋大家都認識咗一段時間啦，我哋喺議會上面都合作無間啦，好可惜即係最尾即係俾政權 DQ 冇辦法繼續喺議會裏面為香港人發聲，去大家一齊去並肩作戰。其實我都想問翻你，其實你呢4年咧即係不斷受到好多嘅打壓啦，即係亦都俾人拉咗幾次啦，好明顯政府係去針對你，用唔同司法系統又好，或者係用唔同嘅方式，亦都係你做好多嘅司法覆核去挑戰呢一個咁腐敗嘅政權。即係我覺得你可唔可以講多啲你呢啲嘅經歷，同埋你呢一種嘅抗爭，對於你成為一個立法會議員嘅志業有啲乜嘢即係有咩付出喺裏面呢？
對我嚟講，多謝阿聰你嘅問題啦。議員就係要全面擺低自己。我成日喺抗爭嘅前線，好多嘅手足好會問，其實我哋仲有啲咩可以做？其實係不斷驅使到我諗，我作為議員呢個身份有咩可以做呢？咁實質上我答佢，就算我唔係議員，我都會喺前線同場場都喺度出席㗎啦。咁但係我既然有議員嘅身份，我就更加要喺前面保護大家。呢個係非常之重要，俾全個社會係同人民企埋一齊嘅。呢個第一啦。第二，喺議會嘅抗爭空間，的確係越嚟越細啦。阿聰，你當然會體會得更加多啦，即係可能會隨時起身冇咗個議席。但係當你喺議席嘅時候，係要抗爭到底嘅。我係好唔願意做一個淨係投完票鬧完坐翻低嘅議員。我覺得要身體力行。咁所有嘅要向前衝嘅時候，就要向前衝咯。第三就係我哋仲喺體制裏邊嘅人嚟嘅。我哋除咗喺街頭之外，我哋點樣善用呢個體制呢？咁所以即係你講得好啱，好多官司在身都係我告翻政府嘅，因為我覺得要係用司法嘅制度裏邊俾翻政權佢哋自己應該承受嘅嘢，去俾最大嘅壓力佢哋，亦都逼佢哋犯錯，亦都逼佢哋咧係承認呢個錯誤。咁呢個係多線進行咯。可能講到嘅國際戰線， 咁大家都係要做嘅。咁英文講多幾句，係走多幾個國家係相當重要。
從阿 Ted 嗰個付出，我哋見到咧，其實做立法會議員咧，唔單止係入去議會裏面議政，或者甚至唔單止咧就係做議會抗爭，其實有好多用你憲制身位做到嘅事情咧，係會令到你非常之繁忙、非常之大壓力，同埋有好多唔同嘅空間咧，你係要去自己主動去開拓、主動去爭取。咁所以其實我都想問即係跟進翻，其實係鄭同學嘅問題，即係楊雪盈，你應該都係18區裏面唯一一個參與嘅區議會主席，如果我冇記錯嘅話。
快問。
咁你會唔會承諾係辭任區議會主席去投身立法會咁繁重嘅工作？
頭先我已經講咗，最重要係點樣幫到香港人。咁我相信我並唔係第一個 multitasking 嘅人。
好，時間到，跟住徐子健。
OK， 咁大家好，我係徐子健啦。今次呢個嘅，我哋希望可以做到揾到最合適嘅代議士，香港市民，等我哋可以過半數嘅議席。咁其中我相信有一樣嘢就係叫做齊上齊落啦。唔知在座各位同唔同意咧？係，
你問邊位啊？
各位全部請答。
我答啊，或者我可唔可以答？
係，多謝。
同意啊，同意啊。
多謝晒。
同意啊。
咁當然亦都唔希望我用一個好抗拒嘅方法，或者係鬧交式嘅方法同大家傾啦。鬧完之後，大家以後點合作啫？係咪先 ？OK， 呢啲我都係要講嘅。唔好意思，兩位政黨先好冇？即係阿大雄先啦，唔該。咁因為確實嘅，公民黨利用一個方式就係當次投票嘅時間上中下咁啊投晒啦，上中下三路贊成反對棄權，甚至唔見咗人都有啦試過。咁呢啲咁嘅情況之下，其實唔係我講㗎。係確實係有好多嘅選民對於呢啲咁嘅狀態非常之覺得不滿嘅，即係嚟緊未來，我唔講話之前啲咩可能性啦嚇，即係你做咗會點嗰啲啦，我係講未來，如果大家真係35+成功咗，我哋可唔可以真係一齊投咧？而唔係
不如俾鄭大雄答啦，好嘛？
好啊，咁你頭先講嘅一個投票咧，其實我講咗好多次，張舉能嗰個至少3次回答咗，咁不過唔緊要。之後嘅所有嘅議會嘅抗爭，
你知道其實之前都
知道，我想同你講
我係想問以後大家可唔可以將嗰啲咁投？
所以今次嘅選舉，希望咁多位選民咧出嚟投票，因為真正去到35+，我哋達成議會過半咧，其實喺我哋今次嘅選舉咧，民主派先可以用個選票去逼使行政長官咧係即係佢要落實5大訴求。我哋用否決，我哋喺3月26號咧講得好清楚，係會否決財政預算案，逼使行政長官。
咁第二個問題啊，如果35+唔得嘅話，會唔會翻去以前嗰個日子？
以前個日子就係即係簡單嚟講，其實議會抗爭唔淨止係投票嘅，包括內務委員會郭榮鏗喺度半年嘅時間，係創造嘅一啲議會抗爭嘅先河。
唔該晒，
第二樣嘢國家期都係俾人。
鄭大雄，不如問個政黨係咪？
我想問聽，麻煩你許智峰答一答，因為你都係投棄權嘅，麻煩好快咁答翻頭先嗰兩個問題啦。
民主黨相對係光譜闊嘅政黨嚟啦，可能就係我啦，亦都有和理非啦。咁所以我覺得要包容唔同嘅睇法，但係我想清晰地話俾阿子健你聽，喺關鍵嘅議案我哋從來都冇缺席過嘅，即係包括施政報告同埋所有財政預算案，過去4年我哋都係投反對嘅。
OK， 唔該晒。
好，時間夠啦，跟住贏嘅主場時間。
係。大家好，其實我今日喺事前亦都有同大會講過，我對於呢個自由搏擊嘅環節咧嘅想法。咁因為其實我之前都覺得搏擊應該係對建制派、對呢個專權嘅政府，而唔係對自己人，唔係對手足。我相信在座咁多位坐得喺度，都係香港非常之出色嘅從政者，我深深咁樣敬佩。亦都喺今次嘅立法會選舉，我想話喺立法會選舉從來冇咁需要我哋嘅勇氣同埋香港人嘅勇氣。我哋見到喺呢個政權不斷咁將我哋打壓之際，到底我哋可以團結到邊一個地步？
楊雪盈，你唔想搏擊都可以問問題㗎。
係。頭先我都有回應到一啲關於就係建制派最開心見到我哋嘅場面，而我想逐一問在席嘅咁多位，如果要揀4席係進入立法會，我希望大家提供一個選擇俾咁多位香港人。希望由我身邊嘅梁晃維先。
如果真係要選擇4個喺港島區嘅候選人嘅話，我會選擇許智峰、羅冠聰，我本係彭卓棋。
徐子健。
我會選擇阿 Ted 啦，係咁跟住就會選擇我啦，同埋選擇羅冠聰啦，同埋都會選擇梁晃維。
我會選擇梁晃維、許智峰、鄭大雄同埋袁嘉蔚，因為我覺得今次初選唔係淨係選我哋每一個人，我哋有更加大嘅任務係要喺唔同嘅角色度
講名得啦，唔該。
付出。
係鄭大雄。
多謝你問題，但係你頭先個開場白咧，其實就係我都唔明點解係要呢個時候去
我希望可以俾香港人，
所以我希望香港人係可以睇到我哋今日出嚟嘅每一張名單都係所以希望大家都呢個先係我哋對抗極權嘅最緊要嘅一個邏輯，所以希望大家都支持35+。
Michael，
呢一個問題好同意鄭大雄先生嘅説話，呢個係會分化我哋自己。反而我會覺得就係我 anyone but you， 唔係楊雪盈。點解呢？楊雪盈你喺文化界其實有機會勝出嘅，你應該可以一齊同我哋之後揀咗嘅4位嘅議員。
有體育界嘅人想出選，
你係最呼聲最高嘅嗰一位，但係你為咗喺直選出選，
咁請呢一個，
你覺得你係最有機會贏嗰個㗎？你應該係文化界㗎，你
少少時間俾另外兩位講。
文化界喺文化界貢獻咁多，我覺得你係有能力，同埋我
文化界已經有體育界嘅前輩係想選，我一路以嚟由2012年開始都係堅實嘅文化界嗰度做一個助選。請阿 Ted 唔該。
我答啦。4位係手足 A、手足 B、手足 C、手足 D， 所有真香港人都值得入議會。
多謝。
呢個初選係香港人嘅初選。
唔好意思啦，冇時間啦。好啦，咁我哋最後一位自由搏擊時間咧係梁晃維。
好。唔好意思啦，可能又要麻煩鄭大雄啦。咁咧頭先你要講到話咧，光復法治咧就係要做好法律支援，為手足揾證據。咁但係今日咧，我哋見到咧喺成個法律制度入面咧係充滿一啲所謂嘅紅官、藍官。藍絲斬人咧就俾人讚情操高尚，我哋嘅手足社工，佢哋咧係只不過喺防線面前舉高呢個社工證，叫警察咧已經係要面臨1年監禁。點解公民黨同埋鄭大雄你仲未敢講法治已死咧？
因為作為一個嘅無論學生又好，法律從業員又好，我哋可唔可以拋低一句法治已死，我哋就走咗去呢？我相信唔得。我講一個實際例子啦，即係之前6月9號有大概100幾人被拉咗啦。我有一個法律嘅學生同學入到警署嗰度，支援喺出邊行下都走下做下嘢。咁但係我個法律學處8粒鐘齋企喺度入資料。去為每一個手足可以盡快出嚟而搏命。
好，唔該。
我係唔可以同佢講話放棄咗法治。
阿達你好啊，其實我哋今日咧，請你唔好再喺度混淆視聽。法治同埋司法制度咧係2件唔同嘅事情。香港係有佢法律，有司法制度。你哋繼續喺個空間入面咧去爭取，去繼續為手足去爭取更大獎嘅。咁但係個問題就係、香港人根本滿意鄭達鴻嘅就係點解過咗咁多年之後，你仍然要香港人就係我哋嘅司法系統，我哋嘅法治係仍然有險可守。香港人係非常之明今時今日呢個咁樣嘅制度入面，我哋根本係唔能夠彰顯到法治。你見到過1年咁多嘅手足走上街頭，佢哋喺 stand and fight 嘅時候，就係因為佢哋唔相信香港嘅制度啊嘛。但係做翻公民黨 stand and fight，竟然就係叫香港人繼續相信呢個制度。咁其實到底你哋公民黨係咪同我哋
如果我哋淨係同你講話相信制度，我相信唔係今時今日公民黨嘅立場。我哋要唔同嘅戰線去捍衛。手足俾人拉咗，我哋一定嘅事件啦。其實 CJ 都出咗聲明，我唔知你睇唔睇。咁但係呢啲係每一個程度、每一個環節，我哋都要做噶嘛。我就係話俾大家，學生畫咗一個法律從業員係冇個
你能夠進入呢個立法會入面，你覺得可以點？公民黨憑住你能入呢個立法會入面，你覺得可以點樣幫到香港繼續做到你話 uphold 而家嘅制度？你啱仲講緊話，希望咧香港係尊重3權分立。喂，大佬，但係今日政府已經擺到明係行政凌駕於嘅時候，點解公民黨或者鄭達鴻仲講得出我哋香港係一個有3權分立嘅社會呢？另外而家嘅問題咧都想，而家啲問題想轉去第二個。
所以頭先講3權分立嘅例子咧，其實係講緊支持。
而家係希望咧，我係希望個候選人啦。
今時今日
梁晃維
法嚟到，
我想問下 Michael 嘅，頭先你講到話本土派就係堅守香港核心價值，今日政府咧都同我講話要守護香港價值，咁到底你眼中乜嘢係本土派咧？
但係
時間啦，
我唔知啊，OK。
跟住落嚟啦，係最後一個環節啦。經過激烈嘅互相提問之後咧，每位嘅參選人咧有10秒嘅時間總結。咁個次序咧，我哋就調翻轉頭，由梁晃維先10秒時。
國安法咧好大機會喺6月30號就通過。香港人係必須要清晰地向世界展示我哋嘅法治。香港人街頭見。
跟住楊雪盈。
各位香港人。我願意憑藉2次勝選區議會嘅經驗，同大家一齊喺立法會裏面繼續努力。請支持我楊雪盈，多謝。
好，跟住咧就係除
國安法 將會加諸香港，我哋連條文都唔知，更人會覺得好灰暗。但係我仍然相信有希望，我見證。
好，時間夠啦，跟住羅冠聰10秒時間。
喺一年嘅反送中運動當中，香港人見證咗團結係可以改變一切。7月11、12，請支持堅定嘅抗爭派，街頭議會國際缺一不可。
跟住到鄭達鴻。
香港人今次可能係唯一，亦都有機會過半。希望你初選出嚟投票，支持我公民黨鄭達鴻達成議會4席，港島4席。
然之後係彭卓棋嘅團隊，
看自由來齊集這裏，全力抗對。共產黨要我跪，我哋抗爭，對抗共產黨。
跟住請許智峰。
我哋下一場要贏嘅就係議會過半，要成功就係要初選成功。我請大家全力支持初選，出嚟投票，香港人加。
好，最後係請袁嘉蔚。
今次呢場初選好重要，我哋要為民主派協調最堅實嘅陣容，9月光復議會。無論你想投邊一個都好，711、712出嚟投票。
好啦，今日嘅港島區競選論壇到此為止。咁嗱，我哋仲有嘅就係聽日咧會有新界東啦，下星期咧係會有新界西嘅論壇同埋超區嘅論壇嘅。好啦，講多次，呢個論壇呢係由4個機構合辦嘅，咁包括就係蘋果日報、長新聞同埋城寨嘅。咁大家記住啦，就係初選投票時間7同埋7月12號。
Injustice in health is the most shocking and the most inhuman. He said, the most inhuman, because it often results in physical death. Of all forms of injustice, inequality, healthcare, the most inhuman. So it is unfathomable.
While the House continues in its break, we're going to show you some of today's debate over Affordable Care Act changes. The Democrats' bill would increase tax subsidies for ACA insurance premiums, expands the number of people who qualify for the subsidies, and encourages states to expand Medicaid. This is the portion where Energy and Commerce Committee members speak.
Madam Speaker, as Americans continue to face the COVID-19 pandemic and a severe economic downturn, they're justifiably concerned about their health and their financial future. Today, we're here to provide more relief to the American people, and I rise in strong support of H25, the Patient Protection and Affordable Care Enhancement Act, legislation that will make health care and prescription drugs more affordable and will expand access to health coverage. This strengthens the Affordable Care Act for the future, which is critical at a time when the Trump administration and Republicans continue to support a lawsuit before the Supreme Court that would strike down the entire ACA. These actions could result in 23 million Americans losing their health coverage and the elimination of critical consumer protections for more than 130 million people with pre-existing conditions during the middle of a pandemic. Sadly, this is nothing new. Over the last 4 years, the ACA's progress has been halted and in some cases reversed by the Trump administration's sabotage campaign. Thanks to the ACA, the uninsured rate is historic low. However, the Trump administration's actions have driven up the uninsured rate. Today, millions of more Americans are uninsured and afraid they'll not pay the cost of care if they become sick. The Patient Protection and Affordable Care Enhancement Act trends. This legislation is a common-sense, fiscally responsible one-two that uses the federal government's savings from lowering costs to lower health insurance costs for Americans. The bill does this by empowering the Secretary of Health to negotiate a fair price for prescription drugs. This legislation stops the gouging at the pharmacy counter and ensures that Americans no longer pay 4, 5, or 10 times the amount people in other countries pay for the exact same drug. And this negotiation not only levels the playing field, but it also hundreds of billions of dollars. H.R. 1425 will then reinvest these savings to lower care costs for consumers and to expand access to affordable care. More middle-class Americans would receive financial assistance with monthly premiums. A family of 4, for example, with an annual income of $60,000 would save $2,000 annually, and a family of 4 with an annual income of $100,000 who previously did not qualify for subsidies would save $8,000 every year. Now, this is in addition to the savings that they also had under the underlying ACA. This is under this bill in addition to what they normally save. And that's real savings to hardworking families. Legislation also lowers American health care costs by reversing some of the worst sabotage from the Trump administration. It reverses the administration's expansion of junk insurance plans that leave patients saddled with thousands of dollars in medical debt. It restores critical outreach and enrollment funding that was gutted by the Trump administration, and it reduces racial and ethnic health care disparities. It also builds on the ACA's Medicaid expansion and further strengthens this important program. It provides additional incentives to states that stubbornly refuse to expand their programs. And for political reasons, many of the red states have done that. They just refuse to expand Medicaid. But these holdout states, if they expand Medicaid, 1 million people would gain Medicaid coverage overnight, including 2.3 million uninsured. This bill also takes an important step to address the quality crisis by extending Medicaid postpartum coverage from 60 days to 1 year. Simply put, this policy will save lives. So, Madam Speaker, the Patient Protection and Affordable Care Enhancement Act lowers health care and prescription costs, expands coverage for millions of Americans, and reverses the Trump administration's years-long undermine Americans' access to quality and affordable health care. I strongly urge my colleagues to support this bill, and I reserve the balance of my time. Thank you, Madam Speaker.
The gentleman from Oregon is recognized.
Well, thank you, Madam Speaker. I yield myself such time as I may consume. Madam Speaker, our constituents are looking for us to put aside partisan politics, not to play political games, and they want us to find common ground to address the unprecedented, deadly challenges caused by COVID-19. We need to work together to lower prescription drug prices. We need to work together to aid states and stabilize markets damaged by the ACA. We need to work together to lower out-of-pocket costs for patients, including capping seniors' drug costs under Medicare, encourage participation in private health insurance, and we really need to fund our community health centers. We need to increase the options available through the market and end surprise medical billing. We could do all that. We could do it together, and it could become law. Unfortunately, instead, here we are, wasting time on a partisan bill that has zero chance of becoming law. This is no way to govern at any time, but especially in a pandemic. At a time when we're asking our nation treatments to address COVID-19 at record speed and with record investment, Democrats want to enact a socialist drug pricing scheme that could devastate this country's innovation in the middle of a global pandemic. Frankly, it's unconscionable. This legislation before us today provides $100 billion in bailouts for insurance companies at a time when insurers are not paying for elective procedures due to COVID. Now, we all want to make premiums more.